For their attendance for the inaugural Virtual Women's Health Summit, which is sponsored by Candid Conversations with Dr. Diamond and Miss Tamika. So I am Dr. April Piercy, and today as participants, you have the opportunity to hear professionals that will be speaking on issues that affect women. Without further ado, our first presenter is Dr. Jennifer Wells, who will be speaking on women's heart health. So Dr. Wells, I would like to turn it over to you at this time.
There we go. All right. Well, just as a means of introduction, I would like to tell you a little bit about myself and my background. Upon graduation from Radford University, I began my nursing career in 1995, working in the neonatal intensive care unit at Cape Fear Valley Medical Center in Fayetteville. After 9 years there, my focus turned to nursing education, and I completed my master's degree at Duke University. For the past 16 years, I've been teaching at UNC Pembroke in the Department of Nursing, where I've served in many capacities, including program chair of the department and founding director of program outcomes. In 2013, I completed my PhD in nursing from UNC Greensboro. My passions in education revolve around women's health and the neonatal population. I have a very strong interest in the topic of cardiovascular health. And I wanted to share, this is what someone with cardiovascular disease looks like. I have a very strong genetic predisposition to high blood pressure. I've been being treated for about 10 years now. And I also have genetic risk markers for diabetes and obesity. And so we're going to talk about how all of that plays into your cardiovascular health today. But as you can see, you can't see those things in these pictures, but you can see my beautiful children. So I'm sorry, I have to show them off when I speak. So cardiovascular disease, what is it? According to the American Heart Association, it's the buildup, a narrowing of blood flow in your blood vessels. If you can see in this picture, it is those yellow parts that are in that vessel. My pointer's not wanting to work right now, but it's the yellow pieces that you see inside that vein, and those are called plaques. And those come from our diet, the things that we take in and the things that we do and we don't do. But you can see those blood vessels there at those blood particles there at the bottom of your screen, and they're trying to get through. And you can see on the other side how they're getting through kind of very slowly, one at a time. So how does this impact us and our health? Well, it can lead to stroke, which is the interruption of blood flow to the brain. It can lead to heart attack, which is actually death of the heart, the cardiac muscle. It can lead to heart failure, which means that our heart is not able to pump enough or well enough to meet the needs of our body. It can lead to heart valve problems, which means they're not closing effectively inside the heart, and blood is either going back up or it's not going down adequately enough. Or it can cause an arrhythmia, which means the heart is not beating like it's supposed to. I'm sure that you all cannot read this picture, but I'm sure that you can see the colors. This is a picture from the Center for Disease Control. This is a heart disease death rate from 2015 to 2017 in women aged 35 and older by county. Know that dark is bad and light is good. And so you can see we are in an area of the state of North Carolina that is pretty dark. And we are in an area of the United States that is dark itself. Heart disease is the leading cause of death in women in the United States. In 2017, it was the known identified factor in 300,000 women's deaths. And that breaks down to 1 in every 5 female deaths. Heart disease is the leading cause of death for African Americans and Caucasians in the United States. About 1 in 16 women aged 20 and older have coronary artery disease, and that's the most common type of heart disease. So as you can see, we are definitely in an area of the US that has very strong propensities for cardiovascular disease. More statistics. My job at UNCP is to manage the statistics in the Department of Nursing, so I'm a very big numbers person. According to the CDC, heart disease was the leading cause of death in the United States in 2019. So again, that trend started in earlier than 2017. It is continuing. According to the American Heart Association, as of 2019, 46% of adults in the US have high blood pressure. And that statistic is based on the measurement of blood pressure of 130 systolically over 80 diastolically. And systolic is the measurement of the force that it takes blood to flow through a vessel after it has been collapsed. And that bottom number, that diastolic number, is the amount of force that it takes for blood to flow through a vessel that is not compromised, that is not having pressure placed on it. To see how fast this issue was growing, in 2009, just 10 years before those statistics I just gave you, 1 in 3 US adults had high blood pressure with a direct and indirect cost of $51 million. The impact to African American women was 47%. In 2009, the overall death rate from high blood pressure was 38.6% in African American women. This places African American women 10 years ahead of the national average having high blood pressure, 10 years ahead. It is estimated that by 2035, 45% of the US population will have some form of cardiovascular disease, costing $1.1 trillion with a T, trillion dollars in direct and indirect cost to healthcare. Huge impact, absolutely huge impact. It's growing exponentially. So let's talk about cardiovascular disease and ethnicity. How is it affecting some groups more than others? According to the Center for Disease Control in 2014, African Americans had the highest incidence of high blood pressure, which was associated with the largest death rate related to cardiovascular disease and stroke. The American Heart Association in 2013 reported that 1 in 4 Americans had high blood pressure. And again, that's defined as the 130 systolic over 80 diastolic. That same statistic for African Americans was 1 in 3. So across the United States, the average population, the statistic is 1 in 4, but for African Americans, it's 1 in 3. And so in African Americans, it's the highest in the world, and it's developed earlier in life. So it's being diagnosed very much earlier in life. So it's disproportionate. It's very disproportionate, as is the rate of obesity. In non-Hispanic African Americans, 20 years of age and older, 82% of women are considered overweight or obese. And that statistic is different in men. It's only 70% in men. In a study by the National Rural Health Association between 2012 and 2015, 62% of rural Black Americans and 53% of rural Hispanic Americans were living in poverty as defined by an annual income under $25,000. As a result, this study found that 25% of rural African American adults and 20 Hispanic adults were unable to see a doctor within the previous 12-month period, and that was due to cost. African Americans also have more diabetes than non-Hispanic Caucasians, which can also lead to cardiovascular disease and stroke. So as you can see, genetics plays a huge piece in cardiovascular disease. In a longitudinal study from 1990 to 2016 on inequalities in cardiovascular health in premenopausal women, O'Neill et al. Found that African American women living in the poorest socioeconomic conditions have the highest number of cardiovascular risk factors of all the groups that were studied. So that was a 25-year study that was done. Absolutely huge results coming out of it. This study noted that African American women aged 35 to 54 experienced a steady increase in hospitalization due to cardiac-related issues such as heart attack. Other populations during this time were decreasing, and yet African Americans were increasing in their rate of hospitalization. So what are some signs of cardiac disease? How do we know we have cardiovascular disease? In women, signs and symptoms include shortness of breath, nausea and vomiting, or fatigue. And as you can see, these symptoms are vague. In other words, it could be a number of things and not just cardiovascular disease. It can also present as things like tightening in the chest or pressure or pain, weakness, numbness, or coldness in the hands and feet, or pain in the neck and in the jaw and the throat and the upper abdomen, particularly on the left side. And those more extreme signs and symptoms such as arm pain, left arm pain, throat pain are typically how men present. But women, their signs and symptoms are completely different. Sometimes there are no signs at all, which makes cardiovascular disease a silent killer. This information comes from the Mayo Clinic. So what are our risk factors? Well, some of them we can control, which are the ones that you see here in green. Those are the modifiable risk factors. And then there are some risk factors that you cannot change, and those are the non-modifiable risk factors there in blue. So our non-modifiable risk factors are genetics, race and ethnicity, age, which we haven't figured out how to control yet, and genetic factors. So what are the modifiable risk factors, things that we can do things about? Well, there's smoking. According to the American Heart Association in 2016, 1 in 6 males and 1 in 7 females smoked cigarettes. And that's something that we can change, or at least try to change. Obesity is associated with a shortened lifespan and an increased proportion of life lived with cardiovascular disease. In 2019, almost 40% of US adults were considered obese, with almost 8% being considered severely obese. Blood pressure is definitely a modifiable risk factor. So if you're considered to have high blood pressure, it can lead to heart attack, heart failure, stroke, and premature cardiac death. According to the CDC, 47% of Americans have either high blood pressure, high cholesterol, or smoke. Diabetes is also considered a modifiable risk factor for 90 to 95% of people who have diabetes, which is defined as the body doesn't use insulin well or doesn't produce enough insulin to regulate blood sugars. And so that is a modifiable risk factor. So lots of things that we can be doing to help ourselves with cardiac disease. Diet is another one. Alcohol use is another one. And so we're going to talk about in a minute some things that we can do to help be at such great risk for cardiovascular disease. In a descriptive study by Alagil et al. In 2019, 22 people participated in a study to determine identification of risk factors for cardiovascular disease and risk reduction by lifestyle change. When asked about the meaning of risk, one 65-year-old participant stated, "I mean, obviously, being told that you've got high cholesterol is not like being told you've got a terminal disease. If you're told you've got cancer, and if you're told you've got heart disease, it's not as bad as cancer, really. It never occurred to me that sort of thing, high blood pressure, was dangerous, but I suppose it must be." Participants in this study didn't understand the gravity of cardiovascular disease. The study also found that lack of understanding of the risks may have had an impact on engagement with lifestyle changes or decisions to take or continue prescribed medication. Other findings of the study were that participants were unable to afford going to a gym or to participate in exercise programs, and that much support and encouragement was needed from others. Participants in the study reported difficulty changing behavior due to stressful circumstances or work-related issues. Some participants with a family history of cardiovascular disease felt that making a lifestyle impact the overall risk of them getting the disease. So obviously there's knowledge gaps here that need to be covered. So we've talked about risk factors, and we're going to talk in a minute about what we can do. But some people don't understand how serious this issue is. I've read to you many statistics, but how does that personally impact you is the question. Do you understand your risk factors and how serious they are? This person here, this quote compares it to having cancer. Is it like having cancer? It's really something to think about. So what can you do? What can you do? Things that you can do to put you at decreased risk for cardiovascular disease are to know your blood pressure. It is very important for you to know those numbers. What is your normal baseline blood pressure? What is it supposed to be? Everybody's is a little bit different. So we have these standards of, oh, it's supposed to be 120/80. Yours might not run 120/80. Yours might run lower. And so a measurement of 120/80 might be high for you. And so you need to know your numbers. Having uncontrolled blood pressure can lead to heart disease. High blood pressure can have no symptoms at all, so it's very important to have it checked regularly. Talk to your doctor or your healthcare team about whether or not you should be tested for diabetes. Are you at risk? Does someone in your family have diabetes? Do you know what your blood sugar levels are? Do you know what they're supposed to be? And so keeping that in check is very important. Having uncontrolled blood sugars raises your risk for heart disease. Quit smoking. Monitor your exposure of secondhand smoke. And if you don't smoke, don't start. And those are important things to consider. I know a lot of us, we may not smoke, but we may be around others who do smoke on a regular basis. And so being able to monitor that exposure to secondhand smoke is very important because it can also impact you. Discuss checking your blood cholesterol and triglyceride levels with your doctor. Knowing those numbers can be very important. That high cholesterol and triglyceride level in your body can add to the plaque that's in your vessels that's leading to the interruption of blood flow. And so knowing those numbers can be very important, and those can be checked via a blood test. Taking prescribed medications can also be very important. If you do have hypertension, one of the things that a doctor may do after discussing some other things that you can do may be to put you on medication. Typically, if you have one abnormal blood pressure reading, they're going to recommend lifestyle changes, which we're going to continue to get to in just a minute. But they have to have 2 or 3 readings in order to put you on medication. But if they do put you on medication, taking it and taking it regularly is very important. It's also very important if they put you on medication for cholesterol and triglyceride levels to continue to take it. However, I know that there are a lot of side effects, particularly to those triglycerol and high cholesterol level medications. Those are called statins, and they can cause side effects that are impactful. They can cause things like headache or dizziness or weakness or sleep problems. And we don't want any of that. So we stop taking the medication. But we need to realize and weigh the impact of the good that it's doing for you as far as your cardiovascular disease versus the negative impact or side effects that it may be having on you. Make healthy food choices. That is definitely easier said than done. Choosing to eat vegetables and fruits and lean meats, and being aware of how foods are prepared, because how foods are prepared definitely can impact their nutritional value. Get moving. 30 minutes or more per day is very important. Your weight can play a role in your cardiovascular disease risk factors. Being overweight and obese definitely raises your risk. According to the American Heart Association, weight can be very difficult. And I think we all know, I know I battle that one every day. Walking at least 30 minutes a day, eliminating things like sugary drinks and desserts is recommended. Also recommended are things like limiting red meat, decreasing portions of carbohydrate heavy foods, which are your pastas, your rices, your potatoes, all that stuff that's good. Eating whole grains and increasing vegetables can be important. According to the physical activity guidelines for America set by the U.S. Department of Health and Human Services, adults of all ages need a minimum of 150 minutes of moderate intensity activity a week. And so that 30 minutes a day will get you to your 150-minute minimum. Limit alcohol intake to 1 drink a day. And find healthy ways to manage your stress. And that can be difficult as well. Some of those wonderful things that we do to manage our stress are to drink alcohol and to eat foods that comfort us. But those things are not necessarily healthy stress and coping mechanisms. Things like the walking and the stretching, listening to music, journaling, spending time outside, those are healthy ways to deal with stress and things that we don't necessarily turn to immediately. Those are not necessarily our first line things that we go to. All right, February is American Heart Month. And the first Friday in February, which was yesterday, was National Go Red Day. But you can have National Go Red Month. The American Heart Association's signature women's initiative, Go Red for Women, is a comprehensive platform designed to increase women's heart health awareness and to serve as a starting point for change to improve your life and the lives of women globally. This movement is about women making a commitment to stand together with Go Red and taking charge of their own heart health, as well as the health of those that they cannot live without. So I encourage you to go red. All right, here we are wrapping up. These are my reply them to you. I tried to give you the sources as I was going through, especially some of the statistics and things. But thank you very much. I'll be more than happy to answer any questions you might have.
Okay, ladies, if you do have some questions, please put them into the chat. We'll give you a couple of minutes to think of your questions, and I will refer to the chat, get your questions for Dr. Wells. So again, you have a few minutes to go into the chat to put your questions in if you do have them. Okay, Dr. Wells, I do have a question for you coming from the chat. And the question is, how does this impact those with sickle cell?
That is an excellent question. As most of you know, I'm sure, sickle cell causes the cells in the blood to sickle or to form a different shape. And so you are already at risk for those cells clumping or sticking together, and you are already at risk for blood having difficulty time flowing through the vessels. And so cardiovascular disease is going to further interrupt the body's ability for that blood to flow normally in those with sickle cell. So it's those with sickle cell need to be particularly aware of cardiovascular disease, their risk factors, and what they can do to minimize those risks. Great question. Great question.
Okay, one of the participants said, thank you for the presentation. It was very helpful for me as I struggle with high cholesterol and high blood pressure.
Yes, absolutely. Thank
And
you.
then,
I was going to share too, I do have a family history of high cholesterol and triglyceride levels as well. So yes, it's a struggle for us all.
okay, your next question is, have you seen any improvement with pharmacogenomic testing being implemented more into the medical world?
That's a great question too. Pharmacogenetics is not a new field. However, it rolling out and impacting the everyday population is still quite limited. Pharmacogenetics is still being used for disease processes like specific kinds of cancers or disease processes where they're going in and looking at what is this specific disease process that you have going on? What is the specific kind of cancer? What is the specific kind of infection that you might have? And they're trying to engineer treatments specifically for those kinds of things. As far as genetic markers, obviously they're huge for cardiovascular disease. And so the field is open and I believe ready for specific kinds of treatments. We've been able to map the human genome for many, many years now, and the cost of doing that is decreasing and becoming a little bit more manageable. To my knowledge, insurance companies are not regularly covering that yet, but being able to map someone's genome and give them a specific medication or treatment regimen for hypertension or other things that are causing cardiovascular disease would be huge. It would be a huge impact on the United States. So while that's not a new therapy, it is not something that they're using to treat cardiovascular disease to my knowledge at this time.
Okay. Your next question says, hello, everyone. She stated we all may have a baseline for BP. What would be considered high blood pressure for 54-year-old women?
That is a great question. Those baseline numbers, to my knowledge, do not change with age. It is still that classic 120 over 80, 120 systolic that we use as a standard to note. That is what your blood pressure should be. And again, that 120 is noted by when they take your blood pressure, that cuff collapses the vein. And so when they're easing off the pressure on that blood pressure cuff, that first number comes from the first blood flow that we hear flowing through that vessel as it's going from collapsed to just starting to open. And then the diastolic is when we note that we can no longer hear blood flow when we're taking your blood pressure. And so that means there's no pressure on that vein anymore. And so that means that's the pressure that your blood is under at all times. When it's not having pressure put on it. So to my knowledge, those numbers 120 over 80 are still standard even for women. And that's an excellent question. So that 130 over 80, which is considered high blood pressure under new definition from American Heart in 2017, is not very much higher than what is considered normal blood pressure. So good question.
Okay, your next question is, what arm is best to take your blood pressure? And this is the second part of it. My blood pressure is sometimes different on both arms.
Yes, it is. Absolutely. Absolutely. Your left arm is where your numbers should be a little bit higher, and that should be where your blood pressure is taken. Your right arm is blood pressures are going to be a little bit lower, and that is normal, and that has to do with how your heart sits in your body and where your blood flow comes off of your heart, the arteries that take the blood to the extremities. And so that is very normal for your blood pressure to be slightly different on one side than the other. Now, if it is dramatically different from one side to another, then I would encourage you to see your provider, and the provider should then start taking blood pressures when you are laying down and when you are sitting up and when you are standing, because those things have to do with your ability of your heart to adapt to change in position. And so that can indicate other cardiac problems. If I'm not answering your
Okay, next
questions, please feel free
question.
to
If you
feel free to
have
let me
been
know.
diagnosed with, yes, go back into the chat and just let us know. Okay, if you have been diagnosed with a cardiac arrhythmia, do you have cardiovascular disease?
That is another great question. There are many causes of arrhythmias. One of the causes is cardiovascular disease. However, you can be born with an arrhythmia, and you can be born with cardiac problems or develop cardiac problems that are electrical, which is what an arrhythmia is, that have nothing to do with cardiovascular disease. So cardiovascular disease can cause an arrhythmia, but there are definitely other causes of arrhythmias as well.
Okay, that was the last question. If there's any more, Dr. Wells, she does have 5 more minutes before we move into the next presenter. And if you have any comments to what she discussed today, feel free to put that in the comment as well if you need clarity on something she said today.
There were definitely a lot of statistics shared, and I think the main takeaway is cardiovascular disease is killing women, and it's killing us right now, the number one cause of death. And so we really need to consider what we can do in our own personal lives to help decrease those numbers.
Okay, you have one person. stating that one participant said, I have been having chest pains for the last few months. I've had EKG stress test, echocardiogram, chest x-ray. I do have high blood pressure and high cholesterol, and take medication for both. How would you test for cardiac disease and take synthetic medication for thyroid, as I had a complete removal of my thyroid? Do you think of the combination of medication is causing insomnia?
Oh, wow. That's a lot all at one time. I'm glad that you recognize chest pain is not something that's normal that you should be having, and that you are seeking out medical tests and medical treatment. The thyroid does secrete hormones or elements into your blood that impact your metabolism. And so the medications that they give you are artificial medications that are going to be impacting your metabolism. And so too much of that medication can make your heart beat too fast and your metabolism to go too much, and too little of that medication can be causing your heart to beat too slow and things to slow down. And so, yes, that definitely can impact your ability to rest and to sleep, particularly if your medications are a little bit too high. But I do encourage you to talk to your medical provider
Mhm.
about that. Those are some risky factors, but it sounds like you are recognizing them, which is great, and getting them treated.
Okay. Next participant said, hello. What other causes cardiac arrhythmia? What are other causes?
What an arrhythmia is it means typically in your heart, you have one spot that is called the SA node. And I'm sorry, that's just a term where all cardiac conduction starts. There's one part of the heart muscle that says, I'm going to start this whole process. And then, so when it starts, your atria beat and then your ventricles beat, and they have to beat together, and they have to beat in a certain rhythm in order to have adequate blood flow. So top beats, bottom beats, top beats, bottom beats, top beats, bottom beats. And when there's an electrical disruption, in other words, sometimes those beats don't start in that SA node. Sometimes they might start elsewhere. We've got some hyperactive cardiac cells that say, I'm going to take over and I'm going to start your heart beating somewhere else. And so it disrupts this ability of the heart to go top beat, bottom beat. And you have this top, top, bottom, bottom, top, top, bottom, bottom, or you have top, bottom, bottom, top. And it just does this weird pattern. And those are arrhythmias. And so there can be lots of different causes. It can be an issue with the cardiac muscle itself. They can happen when you are born. They can happen later on in life, particularly when you develop stress. A lot of women, when they become pregnant, that's the first time that they experience cardiovascular symptoms, because their blood flow is 150% of capacity of what it's supposed to be. And so a lot of times women, as they age, do learn that they have arrhythmia issues. So there's lots of different causes for arrhythmias. Those are just some basics, but cardiovascular disease is just one of them.
Last question for you is, I've noticed when I work out, my blood pressure lowers to about 125 over 74. Should I still take my BP medication?
Absolutely. That's a great question. There are definitely things that as you improve your risk factors that are going to impact your blood pressure. Being in a good state of exercising regularly and being in a good state of physical health with a good diet and the ideal weight can definitely impact your blood pressure. And so as you're making changes to your risk factors, it is important to allow your physician who's prescribing the medications to know that you are doing that and to be monitored closely. Because yes, there is a chance that you may no longer need that medication, or that you may need a different dose of that medication. So yes, as you modify your risk factors, as you make changes to your lifestyle, there is a chance that you may no longer need those things that are prescribed for you. So work with your physician very closely to make sure that you're taking appropriate dosages.
Okay, well, thank you so much, Dr. Wells. There is a question and answer period at the end of all of the once we conclude all of the presentations. So your question will be read at the end of the day also. So don't think your question won't be answered. So I want everyone to know that. Okay, so as we move along, again, thank you so much, Dr. Jennifer Wells, for teaching us about our heart, because we need to love our heart. Thank you.
Absolutely. Thank you. Thank you
All
very much. Have a
right.
great day.
Thank you. All right. So we're going to move on to our next presenter. And our next presenter is Shelly Blake. Shelly Blake is a registered pharmacist, and I am going to turn it over to her. She's going to provide you some information about what's in my medicine cabinet. Okay, it's up on you, Miss Blake. Thank you.
Okay. Hello, everyone. My name is Shelly Blake. I'm a registered pharmacist. I work both in retail pharmacy as well as medical marijuana as a dispensing certified pharmacist for marijuana. I also work with as a consultant pharmacist for an outpatient clinic for drug rehab. Um, I graduated from Long Island University, and I'm currently completing my doctorate program with Howard University, practicing over 20 years in pharmacy. So what I want to address everyone today is a few questions that I was given, and like Dr. April just mentioned, I'm calling her April by her first name. I asked her about that earlier, but Dr. Piercy just mentioned, one of the questions was, why take medication for chronic condition daily? I just wanted to kind of put out there what's considered some of the top chronic conditions that we are dealing with today, and that would be hypertension, chronic asthma, diabetes, thyroid conditions, and even arthritis, anywhere from gouty arthritis to osteoarthritis, as well as rheumatoid arthritis. And one of the key things to bear in mind whenever you're dealing with a chronic condition is knowing that obviously there's something going on with your body that's not able to maintain its normal capacity as it should. So once you start taking medication for any of these diseases, for instance, as Dr. Wells just mentioned, with high blood pressure, with hypertension, there's something called essential hypertension that a lot of African Americans are dealing with. And that's one area that the medical world has not quite gotten a grip on. As an African American woman myself, I did some research with the university that I'm currently in, and a lot of the focus was placed on areas in which we were transported here, so to speak, when salt tablets were put into our mouths to make us and be able to endure the trip. So when we look at a lot of hypertension, if it's essential, because many of us can be well in shape, pretty much doing all that we should do, and you still can have high blood pressure. And like she said, it is definitely a silent killer. So you want to sometimes try to bear in mind when you're dealing with chronic conditions, it's not necessarily tied to your mother having it or your brother having it or your father having it, but some things were causes of what we were introduced to just being brought here, like I said, with hypertension. So far as asthma, definitely something going wrong with the lungs and the oxygen or the ability to push out air. And then diabetes, usually something going on with your kidneys or the ability to produce insulin. So, and the thyroid, again, condition is something that can create problems with, having hypo or hyperthyroidism, and gouty arthritis if your body's accumulating a lot of uric acid, osteoarthritis if your bones are crushing against each other, rheumatoid if there's swelling. So there's always a condition that's behind the chronic condition. If your body does not manifest to those levels and can keep them down, then yes, you should be on chronic medication, because it's going to constantly present itself. It's not an acute condition. Some people have acute asthma where they use their pump only as needed because they only get the effect when they're exercising or when there's certain seasons. But when you have chronic asthma, you should be on an emergency pump as well as a maintenance pump. And the purpose of the maintenance pump is to keep you from needing your albuterol inhalers or using them as much. So you should be on your long acting beta agonist or something that can maintain your breathing so you don't have to use those rescue inhalers as much. Another area, like I mentioned, with people who suffer from arthritis, like gouty arthritis, they should definitely take colchicine for the pain, but using their allopurinol for the maintenance is key. So just in a nutshell, whenever you're using any medications for chronic conditions, there is an importance to using them daily, because conditions like hypercholesterol, you're not going to see results in a week or two. Usually your doctor will tell you to come back in 90 days. It takes roughly about 90 days for these drugs to kick in. Statins, as mentioned earlier, when you have things like atorvastatin, simvastatin, rosuvastatin, those are all statins. And the number one side effect is muscle pain. So if you do experience things like that, you may want to make mention to your doctor and see if they can switch you to another statin. And the reason that there's so many in a drug family, because the more production of medications are developed, they try and find ways to decrease on side effects. So if the atorvastatin is high in muscle pain, the rosuvastatin may not have that effect. So you definitely want to stay abreast and stay compliant to your medication regimen, but you want to make sure you keep the line of communication open with your physician so that you don't have to stray away from doing it because you don't like the way it makes you feel. Just to also bear in mind, especially with diabetes, that's another one to note. An A1C, again, that's a 90-day reading. Nothing is, and again, unless it's considered or you've been diagnosed with an acute condition, these are all going to be a long-term transition. So you definitely want to make sure you take your medication. Another part of the another question that I was given was, when you are not taking your medication as prescribed, what happens? You cause lapses, you cause sometimes the infection, like even in an acute case, an antibiotic. When you break the cycle of a short-term antibiotic, you give your body the opportunity to get a super infection. So taking medications according to how they're written or prescribed is very key, even in an acute case as well as a chronic case, because once you break the cycle, it's almost as if you're trying to kill ants and you let that area go and you let them build up again, you're just starting at square one again. So you want to constantly keep that level constant so you can get the antibiotic to do its job completely, or you want to make sure that your chronic condition stays below or stays as the area under the curve to stay where they can monitor and you can feel at least better with the condition that you have. Another question was, when should you ask a pharmacist about your medication? Utilize your pharmacist. We're a plethora of information, not just to hand you your medication, but utilize us. If you have a change in the dose, a change in the frequency, even if something changed with your insurance plan and you can no longer get what was prescribed for you, make sure to try to utilize us in the sense of finding out, well, you as well can find out from your insurance plan what your plan will cover and what the doctor prescribed, and try and bridge the gap between the two and find out what would best work for you. But constantly use your pharmacist to find out about your medications. If you, like for instance, the question that came in earlier, if you're experiencing a headache or if you're experiencing, anything that's not transient, and by transient, what I mean is 1 to 3 days of an effect when you start a medication or when you switch to a medication, that's considered pretty much a transient effect, meaning it should come and it should go. But if it's a long-term effect, you should definitely make your healthcare professional aware from taking a medication or feeling worse than what you started off when you start a medication. Another question I was given was, what is the difference between holistic and prescribed? And I have here some definitions because we're a society that's transitioning a lot over into the advancement of a lot of the complement and alternative medicine. So holistic is a form of healing that considers the whole person, body, mind, spirit, and emotions. That's holistic. That's what's considered in our science world as holistic. Complementary, any of a range of medical therapies that fall beyond the scope of scientific medicine, but may be used alongside it in treatment of disease and ill health. Herbal, the study of practice of the medicinal and therapeutic use of plants, herbalism. Alternative medication is any of a range of medical therapies that are not regarded as orthodox by medical professionals. An alternative. So it's basically saying, other than using the traditional or the Western medication, I use alternative medication. Homeopathy, a medical system based on the belief that the body can cure itself. Practitioners use tiny amounts of natural substances like plants and minerals believed to stimulate the healing process. That's what homeopathic drugs are about. Natural medicines, not synthetic. And natural medication, I just want everyone to know, doesn't mean safe. It's just that it's not synthetic. A nutraceutical is a food or a food component that claims to have health benefits, including treatment and prevention of disease. So nutrition and pharmaceutical. So I just wanted to put out there some of the words that you're probably hearing thrown around. They're not necessarily interchangeable, but I know people tend to use them quite a bit and quite more often now. And one thing that you want to bear in mind is whenever you're dealing with anything that's not FDA approved or anything that's considered a health supplement or a nutraceutical or a natural product, there's the department or the Dietary Supplement Health and Education Act of 1994. And what they decided was the FDA doesn't regulate it. They have made the bridge with the FDA that no one would be able to state that this is a preventative, that this is a cure, that this can treat diseases. So just bear in mind when you purchase certain items, you want to really make sure you do your research as to what the source is or the manufacturer is, because there's not a lot of, they can't hold them to anything because they're not studied in the sense of being able to give you data or case studies on the amount of people or what this situation was, and that proves what they're trying to claim. So you just want to make sure that whenever things include vitamins, minerals, amino acids, herbs, botanicals, as well as other substances that can be used in supplements, those are it. You're not going to find drugs in them, but you're also going to have to make sure you research and find out what exactly they're using to treat. But the companies are not able to state that they can cure, prevent, or they can't diagnose any diseases as well. So using herbals, which I'm both Western and non-Western medication, just make sure you have a good source, make sure you're using something that has a good background or a company that's reputable. There's lots of the Food and Trade Commission, there's lots of companies that admin of the Federal Trade Commission. And that's key to find out about the companies that you're using when you're buying or using any type of herbal products. Whenever you see a disclaimer, that's usually a good sign. And what I mean by a disclaimer is when you purchase an item that's an herbal product, just try to note if you notice on there that the manufacturer is willing to say that this does not treat or this does not cure. That's key because that pretty much lets you know that they have a tie-in to the Federal Trade Commission, meaning they are owning up to a certain level of standard, so to speak, versus a company that does not state that. So it's just a matter of time that if they were ever audited, then they would probably have to pull their items. And we've seen many items being pulled from the market for mislabeling. Things like fen-phen, that was a weight loss. It caused valvular heart disease. It caused pulmonary hypertension. Another one was kratom, addictive opiate derivatives. It caused seizures. It caused respiratory depression. Ephedra for asthma, or ma wang, that's used for weight loss. Those things cause irritability, stroke, seizure, and psychosis. So again, I don't want us to feel that anything that's herbal or anything that's considered natural is safe, because it's not necessarily the case. A lot of these items can cause damage. So you want to bear in mind whenever you're making purchases or whenever you're using a product that you pretty much kind of do a little bit of research in it. And I definitely have here a couple of sites you can look into if need be. One would be the www.fda.gov food dietary supplements / and they'll give you a listing of some of the companies and some of the more reputable ones that you can use their items that have had a relationship with the FTC. The other question I have was what type of over-the-counter medication to take for food health? That one is a little, how can I say, I kind of steered away from that, but this is not to steer away from it, but I'm going to explain how I wanted to answer that one. There's no blanket over-the-counter medication that everyone should stock. I'm big on pharmacogenomics or pharmacogenetics, meaning the country is moving away from the one-size-fits-all. We're going more towards what's considered precision medication. And by that is in the pharmaceutical world, there's certain high blood pressure medications that work better for African Americans, such things as calcium channel blockers. There's certain medications that work for versus our counterparts who are white Americans and obese and trying to have children. There's certain medications that we're finding out with pharmacogenetics and pharmacogenomics that just naturally work better for us and for different populations because of that. And the areas right now that are most dealt with in the science world when it comes to pharmacogenomic testing is oncology, psychiatry, and infectious disease. Cardiology is also a part of it. So those are pretty much the top diseases where doctors' offices are probably, you're going to notice a little more, even asking if you want to test, because we're delving more into trying to find out what medications work more specifically for a certain gene of people, rather than a one size fits all. We definitely have a lot more ways to deal with things. So far as our muscle mass, that's one area that I know they're doing research on now, because obesity is a question for us. The term big bone is not truly a term, but it's very hard for us to understand how we're compared to other nationalities. Now, for Asians, when we do body mass index, we have a certain limit because of their genetic makeup, but there's none for African Americans. So there's a lot of things that we know it's a little bit because they have it for certain nationalities, but not necessarily for us. So we still have a ways to go in the medical world so far as dealing directly with African Americans. And there's one area that I also want to make sure to mention, and that when it comes to supplements, things like calcium, when you're dealing with hypocalcemia, when we have low level calcium, I know a lot of people are with COVID right now, very interested in trying to build up their immune system and find out different things that can help them, better, protect themselves from getting sick. But calcium is just one of the supplements that I'm very big on, trying to tell everyone to make sure you watch your calcium, especially as women. Your normal level is 8.6 to 10.3 milligrams per deciliter. And I know women of all nationalities have a tendency to constantly question things when they're noticing their hair loss or brittle nails or eczema or depression or anxiety or memory loss or confusion. Vitamin D, why you see it connected to things like caltrate, vitamin D increases your absorption of calcium. Calcium is the key component, but having good levels of vitamin D is what allows you to absorb it. So when those things are lacking, we see a lot of these results, as I said before, hair loss, brittle nails, depression, anxiety, memory loss, confusion. So you always want to be key in noticing what your calcium level is. And that's, like I said, that's just my personal go-to supplement to make sure your calcium is good. Because once you keep your calcium level good, and then your body's able to absorb a lot of other minerals. And vitamin D is key. So vitamin D helps the absorption of calcium. Vitamin C helps the absorption of iron. We have a lot of iron anemics. I'm a sickle cell trait carrier myself. So it's key to try and make sure that we use supplements and that we're on top of those as well. A lot of times as a pharmacist, you notice your patients, but I am very key on asking what are they doing as supplements as well to synergistically work with their medications. It doesn't have to be separate, but you want to take heed whenever you purchase herbal products and you're on medications. Ask the questions: is there a drug interaction? Will it decrease the absorption of what I'm doing, with my medication? You definitely want to bear in mind, if anything that you're using outside of your traditional medication, you want to bear in mind, does this work together? Because sometimes it can inhibit the absorption of your medical prescriptions and then mask the disease state, and you think you're doing fine, but in the meantime, you're not. So just make sure to utilize your pharmacist to ask the questions. Like I said, if there's a change in frequency, a change in dosing, if the med had to change because your insurance plan is refusing it, you want to just make sure, utilize your resources. And we're usually the front line before you get to the doctor's office, but ask the questions and see if you can get the answer you seek further, and deal directly with your medical provider. I do believe we did have a a question, well, not a question, but I wanted to mention with holistic approach, some of the statistics that I found was that 37% of the 18-year-olds found energy in using holistic products. 33% of adults aged 35 to 54 find energy with using holistic products. 16% of adults aged 55 and up. So why I'm mentioning that is, as we approach, usually after the age 40, we're on the other side of the bell curve, meaning you're great until that age, but things start to deplete once you reach age 40. And as you can tell, the numbers are declining as the age increases. But again, holistic, the research and holistic approach is still very key. It's still very prevalent for all ages. It's just that it definitely decreases as we get older. And a website to kind of just keep yourself abreast with vitamins and what those levels are and what the diet should be is webmd.com/diet/RM-quiz -vitamins-benefits. So there's a lot of sites out there, and that helps with complementary and alternative medicines. You can look up some of the items if you were, told to use it, or if you're thinking of using it. There's certain sites to just kind of do a little bit of research. But again, you want to do everything with caution. And I don't know if there's any questions. I can stop and break for now, or you can let me know.
Okay, yes, I'm about to read some of the questions now. 1 second. Okay. Let's see here. Okay, just received a letter from my prescription insurance, Optum RX, that they want me to take a generic version of Edarbi. I have spoken to my doctor about this, and he does not agree for me to switch. Any input on this? Will the generic work just as best, or is it because it is cheaper?
Okay, just to give you a brief understanding of what generic means. Generic means that the Food and Drug Administration requires that pharmaceutical company to have 80% of the bioavailability, meaning it has to work 80% like the trade or the brand drug. The other 20%, such as things as binders, dyes, gums, that's the area that the generic company can use something different. So 80% of the drug has to be bioavailable, and it has to be matching the trade. So depending on what the medication is, sometimes for certain drugs, narrow therapeutic drugs, things like levothyroxine, things like warfarin, a lot of the seizure medications, you don't want to really switch patients from company to company. Those are very narrow therapeutic drugs, and just the slightest change, you can see a drastic decrease or increase in side effects. What you want to bear in mind whenever you get a generic drug, try and find out if what's called a prior authorization will work. So what that means is your doctor, if he's behind it saying you should use the brand, that's usually just a requirement of a fax being sent to him and him filling it out with what we call a certified medical necessity, saying my patient cannot take the generic, and he has to state why along with diagnosis codes. Many times that does the trick. At times when a company is pretty stringent, depending on what company it is, you mentioned Optum RX, sometimes they're pretty good with giving a resolve to it and complying with what the doctor requests. So that would be my recommendation, to see if what is called a prior authorization can be done for you, and that your doctor can send that out to your insurance plan and get it approved.
Okay. Next question. Can you give the website again?
And that was for the vitamins, I'm assuming?
Is it for the WebMD you were referring to, or the vitamins?
Okay. The WebMD is webmd.com/diet/RM as in Mary -quiz QUIZ vitamins-benefits with an S on.
And okay, and if you can get a moment, if you can actually put it in the chat, that would be great too. So you don't have to repeat it more than once. The next question is, are genetic medications, are they effective as brand names?
Yes, they are. But again, as I mentioned earlier, you really have to be real vigilant in knowing what you're taking and what disease state it is. As I mentioned earlier, certain drugs we do not interchange, but you want to make sure that your pharmacy doesn't interchange them because your doctor wrote it. There's some that I'm pretty adamant about, and I'll contact the doctor back and say, I may need you to do a prior auth because this is a drug such as a warfarin, such as, like I said, a lot of seizure medications that I will not switch. So that has to get an approval from the insurance company. 80% bioavailability. So yes, they can work, but some people's bodies are very sensitive. It could just be, like I said, the gum, the dye, those things that are in it that can cause the person to truly feel different. So if you're finding those effects, as I mentioned earlier, if it's not transient, a 1 to 3 day different feel, and you're finding out it's chronic and it's constantly and it's irritable, then you definitely can make mention to your physician or prescriber and find out, is there any way to keep you on the brand?
Okay, next question. And I'm also going to add a question here too. Is vitamin D3 good to take alone? And then my question too is, why are African Americans more prescribed D3? Because I know for myself, I have been prescribed to take vitamin D, and African Americans have to take that.
And that's of new. That wasn't always the case. Across worldwide, I have someone that I speak to in Ethiopia, which sits on the equator, deficient in vitamin D. So I mean, all that we've done, and there's a lot of people looking into a lot of things, even from the science level of, did we break through so many layers with the ozone, is that we're not getting the absorption that we normally got. So vitamin D is not predominantly African Americans. We've become the recent population that's deficient in vitamin D, but normally you would find this in a lot of Europeans, especially people that live in Alaska and who have limited amounts of sun. But it has, in the past, I'd say 5 to 7 years, it has become a mainstay in our communities as well. Vitamin D3 is considered what we call of vitamin D, which is not a prescription version. The ergocalciferol, which is vitamin D2, is the prescription version, absorbed a little better. But again, that's a short-term use. So if ever you were diagnosed with vitamin D deficiency, you would probably have to start with the prescription version, take it once a week for about 4 weeks, and then you would transition over to the over-the-counter. Vitamin D3 is perfectly fine to use, but again, the number of us that are now requiring vitamin D has skyrocketed. We haven't, surpassed any other nationalities in it. Actually, we're the newest group to the deficiency.
Okay, next question is 5,000 IU enough daily, vitamin D?
5,000 is definitely enough. Again, that's not going to be a quick fix. It's something that you have to take continually. And when you do get your blood, your blood checked, you want to make sure. And the key is to finding out, like I said, vitamin D is almost like the gateway to feeling good. If your vitamin D is off, that means you're not absorbing calcium. You might have bone aches, your hair is brittle, your mood is really funky, because D allows you to get the absorption from a lot of others. So when your D levels are good, usually that's an indication that you're pretty much okay. But 5,000, if you start there, then you want to, continue it for a period of time. And then you should notice, okay, if you notice the absorption of other supplements, if you're taking them, or just in general, how you're feeling, if you notice any improvement, then you should pretty much be on a good track. Way to get it is, of course, the sun, but vitamin D supplements as well would be suffice.
Okay, next question is, I take chlorocalciferol 50,000 UI for vitamin D, just started about 5 weeks now. Will that help with the deficiency?
Yes, that's the vitamin D3 that's over the counter. That's the cholecalciferol. If you're doing the over the counter and you're taking it, yes, you should definitely see a difference, but it's going to take time. These are, again, remember, anything closer to natural is never going to be a quick fix. It's going to take some time. So over a period of time, you should notice or feel a difference, but it's going to take time.
Which over-the-counter brands for supplements are more or less effective?
Okay, for not putting myself in a bad place, all brands have to be pretty much researched. And I'll say this really plainly, you pay for what you get. If you go, inexpensive and, oh, it's a bottle of 500 and I got it from such and such and I'm good for 5 years, nah. You want to put a little more into your supplements. Remember, think of things as a plant. I feel like I'm talking about another product right now, but think of things as a plant. If 5 of us produced a product and I cut my product came from the root of the plant, my other colleague cut it from the stem of the plant, my other colleague cut it from the leaf of the plant, who would you think would be the strongest version? More than likely the person who cuts from the root. My product may cost a little more. The person who cuts from the leaf may be able to sell it for a little less. So you want to put a little more into your supplements, believe it or not, than most people think. You don't want to go super cheap on supplements, and you may want to do your homework to find out what brands are really considered the top brands.
Okay. The participant that wrote about the 50,000 UI, this is the second part of it. It was prescribed medication from my doctor, 50 UI once a week. So this is why she's taking it, because of the deficiency, once a week.
Yes, and that's correct. The 50,000 unit, just take note, it'll probably be something we count from in the back of the pharmacy, but cold calciferol is also over the counter. Cold calciferol is not, as long as it's not ergo, D2, then that D3 is an over the counter version, but you're not probably going to find it too easily, 50,000 units, and that's not going to be long term. You're going to be on it for a while, and then they're going to transition you to the over the counter again once they do blood work again and see where your levels are. And that's when they'll begin to make the transition. But yes, that's correct how it should be done weekly.
Okay, next one. Hi, everyone. I was informed by my doc that insurance companies are no longer paying to test for vitamin deficiency. If this is true, what is the measurement tool available? That's a good question.
That's a really good question. I have not heard that because I'm still getting patients who are getting vitamin D as they're, newly diagnosed. Questions like that, the best avenue or the best way to find out for sure is to call the number in the back of your insurance card. Find out if you're able to have a test done. And usually vitamin D blood work, when your doctor sends you for blood work, it's not necessarily an individual test. So to find out if, when you get your blood work done, that's it. They usually have it done when you have your iron done, your calcium done, your vitamin D levels are done. To say a specific test to go into the doctor and just say, I want my vitamin D levels checked, that's not the normal procedure. It's usually when they send you out for blood work that they send you back with your labs and you can see all the different levels of what you're at. So that one I would definitely check into, but it's usually not a separate test. It's usually when you have your blood panel done.
Are liquid medications or vitamins better to absorb, especially people with digestive issues?
If digestion is an issue, then you definitely want to try liquid. The scope of it may be pretty limited. Not all vitamins are able to be made into a liquid. So if you can acquire some, just bear in mind when you're looking at a multivitamin, because I know there's certain ones that are multivitamins that are out there on the market. If your doctor, if you know you're deficient in certain minerals, or you're deficient in potassium, you're deficient in phosphate, you're deficient in calcium, you want to get a separate supplement, because a multi is only going to give you a very small percentage of that in that drug. So if your levels are low, you can take multivitamins from here to Mexico, you're not going to reach the levels that you need to. You need an additional single ingredient supplement. So liquid vitamins are good, but if that's just in general, that's fine. There's a few, like I said, that do come as an individual supplement as a liquid, but not all. So if you want to make sure you're reaching certain levels, or you're trying to, increase your levels in certain vitamins, you definitely want to try and get a single ingredient.
Okay. Here you have compliments that, I really like the pharmacist, and yes, she's great. And then we also had a follow-up to the vitamin D. I almost had to pay because my doctor specified for vitamin D and she had to appeal that. The situation she was in, as you explained. So there is, okay, something else is coming through. I had to request my doctor to check my vitamin D because when I was having a complete CBC, the vitamin D was not included until I request they check that.
A CBC is similar to what's called a Chem 7. That's more about your blood work. So when I say blood work, what I mean is your calcium levels. There's an addition. You have to have that additional test put on. So she is correct, or he is correct in saying that. So that is a definite route to go, because there's certain, when people say my blood work done, there's several different levels of blood work being done. You can have a basic 7 panel, or you can have the extended version, or you can have, there's the ones that include your liver enzymes as well. So you definitely, when blood work is being done, or when you're sitting there and discussing with your doctor, or he's saying, okay, I'm going to send you over for blood work, take the initiative and ask, okay, is this going to include my liver enzymes as well? Or is this going to just include the basic 7, what we call the Chem 7? So you may have to, at times, make sure they put that as part of what they want to have tested when you go for your blood work, because there's different levels of blood work.
Okay. All right. So I encourage you have a few more minutes here, ladies. If there are any more questions for the pharmacist right now, put them in the chat. If not, when we are done with all of the presenters, you will have another chance to ask questions. So I'll give you a couple of minutes.
And I do want to state one other thing, if that's okay. We do
Sure.
not have to go out when it comes to go without when you're on chronic medications. Make sure. I'm working for, these are major billion-dollar corporations. Your necessity for a high blood pressure medication, for a diabetic medication, for a thyroid medication, for a blood thinner, any of the conditions that are chronic, nothing for pain and nothing for sleep. Those are separate. Anything that's a controlled drug, you can push to the side. But when you have a chronic condition, do not. And I noticed that we African Americans, we do not tend to ask or to request a few days to hold you if you run out of your refills, or if you, like the snowstorm that just hit you, you won't be able to get to the pharmacy and you haven't gotten a call back we haven't gotten a call back from your doctor. The only thing that kind of puts you in a bind is if you're a patient that uses mail order. So I try to tell as many patients as I can, make sure, and it doesn't cost your physician anything, try to get a prescription put at a store level and utilize, if you're a mail order person, utilize that as well. So when something happens, your package got lost, stolen, or inclement weather, you can call a pharmacy, or you can go in and we have a prescription. We can 9 times out of 10 get an override, get you covered till you get your package, or we get an answer from your doctor. Try to make sure you do not miss out on your chronic condition medications.
Thank you, Pharmacist Blake. You have had some wonderful comments here that your presentation was excellent, good information provided. They do want to know if you could put the websites that you provided today in the chat, so then they can follow up and look up the WebMD and the other information you mentioned as far as searching for information about medication and their health. And then I have one other question here. If we run out of prescribed medication and the order is not in yet, can we get emergency supply, which you did talk about, but if you don't mind reiterating that portion again.
Yes, like I said, usually Usually a 3-day coverage. That's pretty much the standard. Sometimes there's more, but usually a 3-day coverage on a like I said, a chronic condition, and chronic conditions do not include pain. Things such as Percocet, it's not going to happen. Things such as Oxy, it's not going to happen. Ambien for sleep, not going to happen. But when it's things like your high blood pressure medication, your diabetic medication, your thyroid medication, you know, an anticoagulant as a blood thinner, those medications, chronic conditions, we will definitely find a way to get you coverage. And it's usually just based on the company. It's not anything that we do with your insurance plan. But if you have a pending case, such as a prior authorization to come through and you never got the medication, now that's not also a situation in which it would not happen. But if you're a regular customer, in the sense of you've gotten this medication many times before, it's just a matter of a refill not being available, or a doctor not getting back to us, those are the cases in which I'm talking about, that you are usually going to be able to get a few days of coverage without any cost to you. It'll just be deducted when your refill comes in. So if you get a 3-day, we get the prescription for 30, you're going to get 27. So, you know, 27 days worth. But again, the key is not to go without. So again, like I mentioned earlier, you don't want to break cycles. You want to kind of keep, you know, you think of it of, you know, like just keeping those levels at level. Once you drop or miss out, you know, sometimes that can make all the difference of your, you know, how you feel, and most of all, and then your condition.
Okay, so if there aren't any more questions right now, thank you again, pharmacist Shelly Blake, for providing such wonderful knowledge to us all. Because again, when we don't know what to ask, but you provided wonderful information to us about the pharmacist is just more than the person that just count pills and pour medicine into the bottle. You do a lot more. So we encourage that you speak with your pharmacist when you want more information, because at times, I know when you're at the doctor's office, sometimes they rush you out and then you don't have time to ask questions. But utilize your pharmacist. Your pharmacist is very knowledgeable of the medication, although they're not the ones to prescribe the medication, but they know what the medications are, side effects. And even when you're at home, please give them a call so you know what's going on. Okay, so with saying that, thank you again, and we'll be moving on to the next presenter. Okay, so our next presenter is Serena Wills. She is a national board certified health wellness coach. So, Serena Wills, I'm going to go ahead and turn it over to you. And today she'll be talking about GYN on ovarian cancer awareness. Serena Wills.
Ovarian cancer awareness advocate. So I hope all of you heard that. I hope I've been unmuted. Okay. So with all of that, just a little bit of a background about me and what led me into becoming an ovarian cancer awareness and GYN cancer advocate. I was my mother's caregiver. At the age of 60, my mother was diagnosed with stage 4 ovarian cancer. And she was diagnosed August of 2009. And 6 months later, actually, this month marks 11 years, she passed away to the cancer. She thought because she was going through menopause, because one of the questions is, what kind of symptoms does ovarian cancer display? Well, unfortunately, a lot of women, actually more than 80% of women are diagnosed, over 80% women over the age of 60 are diagnosed with stages 3 and 4 of ovarian cancer. And a lot of them, it mimics menopause. So that's why a lot of women don't know sometimes the difference between am I just suffering from menopause, or am I just dealing with, symptoms, because the symptoms are very vague. Ovarian cancer is a cancer of the reproductive system. It is actually, it starts naturally in your ovaries, and it is not detected by a pap smear. So I just want to make that clear to all the women who are listening. So when you go for your annual, which you should be going every year to get your annual exam, um, your doctor cannot detect or screen for ovarian cancer during your pap smear. So that is, unfortunately, the problem with ovarian cancer is it is very hard to catch. It is hard to screen. There is no accurate screening to this day for ovarian cancer. So just to back that up, with ovarian cancer, there's also other gynecological cancers, in short, GYN cancers. So we have ovarian cancer, that's actually the number one leading reproductive cancer that causes death in reproductive cancers. Then we have cervical cancer, and cervical cancer is actually the easiest cancer of the reproductive cancers to catch. That actually can be detected in a annual pap smear. If when your doctor does their exam, they send in their the results to the lab, and with that, um, it comes back and they will tell you, your results came back normal, or there is some abnormality in the cells. So from there, they can test and go further, and they may do a biopsy to see if you do have cervical cancer, or what some women are diagnosed with before cervical cancer is what is now known as HPV, human papilloma virus. Back in the 90s, HPV didn't really quite have a name. So it was, your cells are abnormal and you have to go in for biopsies and further testing. And from there, some women do deal with reoccurrences of human papillomavirus, and some go dormant. I actually am a case. I was diagnosed with HPV in 1995 at the age of 20, not knowing what it was. So my results came back abnormal. I got a biopsy done, thank goodness. Everything was benign. Had a reoccurrence in 2001. Went through the same thing. I had to go through a couple of different procedures, and knock on wood, thank God, everything has been dormant, and I've been in remission ever since. So there's cervical cancer. With cervical, if HPV is not treated, it can lead to cervical cancer. There is vulvar and endometrial cancer, and vaginal cancer as well. So those are the five reproductive cancers that women can get. So with just some statistics, and I'll go back to saying a little bit about my mother's story, there are 1 in 78 women right now in our lifetime are at risk of getting ovarian cancer, unfortunately. And 1 in 108 women in their lifetime are at risk of actually dying from the cancer. Out of all the cancers, and we're talking all cancers, ovarian cancer ranks 5th in cancer deaths among women. The top one right now is still breast cancer. That still has like the highest rate of our women dying from a cancer. So with ovarian cancer, going back to my mother, she thought that, I'm just dealing with menopause, and, she had the symptoms. So just to tell you a little bit about what the symptoms are, because some of you may be asking, what is that? Ovarian cancer symptoms are very vague, very vague. So some of them include bloating, trouble eating or just feeling full quickly, pelvic or abdominal pain, feeling the need to urinate urgently or often, And sometimes that could be also confused with having just a urinary tract infection. Other symptoms include fatigue, upset stomach or heartburn, back pain, pain during sex, constipation, menstrual changes, which women ages 60 and over, and some women ages 45 and over are now experiencing menstrual changes. Those are just the common symptoms of ovarian cancer. So it's very vague. It's not like, oh, I have this symptom, so I must go to the doctor and see if I have ovarian cancer. It could be any of those symptoms. When you get to perimenopause stage, you start feeling a great deal of fatigue, which, yeah, I'm dealing with right now. So people may get very, alarmed to see, oh, what's wrong with me? And one of the questions asked was, when should I go to a doctor? If I'm experiencing these symptoms, what signals tell me it's time to go to the doctor right now? So my mother was dealing with a few of these symptoms and they started out very vague. And she thought, I'm just going to, just get through this menopause cycle. And once I'm over the hump, I'll start to feel better. Once those symptoms started to really exasperate, it was very troublesome at one point. She went, to about 2 weeks without making apple. She wasn't really eating, the month of like July. She just really would just eat soup and very light meals. And she said, oh, it's hot. This is probably why I'm not really that hungry. I'll just eat lighter. The back pain became more immense. So what led her to weakness and trouble breathing, shortness of breath. In the story, she went the first time to the hospital, to the emergency room. Unfortunately, she was misdiagnosed. And they say, you just have a bout of constipation. We'll give you some Imodium AD and send her home. Literally. So they sent her home with just a bottle of Imodium AD. A few days later, she went back to there, and that is when they did an ultrasound, a sonogram. They did her blood work, which is they actually did what is called a CA-125, which is a cancer antigen 125 test. Her numbers were through the roof. Your CA-125 should be no higher than 35 or so, and hers was about 2,000. So from there, when the sonogram and the ultrasound came back, unfortunately, on the screen, and by that time, the cancer had already spread. And, took just another day or two to really give her proper diagnosis that she had stage 4 ovarian cancer. So she did not want to, of course, hear that news. No one wants to hear that news. And now the decision was, what are we going to do in regards to treatment? So I talked about the ages affected. It is mainly seen in women, 60 and above, but we're now starting to see more women per se. And I want to also say girls and young adults are now experiencing ovarian cancer. As soon as you have ovaries in your body, you are at risk of getting ovarian cancer. I actually met a 9-year-old a couple of years ago who had ovarian cancer. She was 9 years old, and she actually spoke at an ovarian cancer awareness race. And her parents said that is something they never thought they would ever see in their lifetime, is their 9-year-old girl having to go through ovarian cancer, now treatment, chemo. Thank goodness, her symptoms, everything was in remission. Her cancer was in remission. And she had to have, unfortunately, a surgery done, opting to do. But in her case, she had to have a surgery done where they had to remove her ovaries. So now at the age of 9, she found out that she could never have children on her own. So it is now affecting all ages, but the older you get, the higher the risk is for getting ovarian cancer. I know in the American Cancer Society said in 2021, the year we're in now, it is estimated that 21,410 women will be diagnosed this year. And close to, these numbers have kind of stayed the same over time. Close to 14,000 women this year estimated will die of ovarian cancer. In the year of 2018, because statistics are sometimes over 22,000 women were diagnosed. It was like 22,500. And around 14,000 women did die of ovarian cancer, unfortunately. So one of the questions that was asked was, you know, why should you not ignore signs in your body when your body is talking to you? The symptoms can be the most vague. It could be the most troublesome. I don't want you to wait until your symptoms are troublesome to go get checked out. If it is something out of the normal, whether you're experiencing shortness of breath or pain, discomfort, digestive issues, lower back pain, especially, you want to make sure you're getting your annual exams. It has been very pandemic that we are in. A lot of places were closed. I had to actually postpone my annual for several months, but you want to just start the conversation and talk to your doctor. And just say, I'm noticing these symptoms are out of the ordinary. I would like to talk to you, especially if they're the symptoms that are on the ovarian cancer symptoms list. I would like to just have a conversation and dialogue with you about, ovarian cancer awareness. Can I get a CA-125 blood test, which your provider can just do? That's a lab write-up, so they could just do the lab slip and you can get that checked. Unfortunately, with African-American women with the CA-125 test, unfortunately, we are shown to have lower levels circulating ovarian cancer markers. So for example, if I get a CA-125 every year now because I'm considered high risk because my mother had ovarian cancer. My markers, thank goodness, have been normal, but because I'm African American, my numbers or my marker might be lower. I don't know why that is. I tried to dig in and do further research. So that is that. So it's harder to detect that cancer marker in African American women. And this is also a bit tricky, and my doctor had to appeal. I heard someone having to appeal just to get like their vitamin D3, for example, done, is I get a transvaginal ultrasound every year. Like I said, there's no accurate screening for ovarian cancer. So they want to at least try to see my ovaries as close as they can. So I get a transvaginal ultrasound every year. There was one year where I had to, my doctor had to make an appeal to the health insurance company. They didn't think it was necessary to do that. And they said, well, she has pretty good medical history. And my doctor said it's because of her mother. Her mother had ovarian cancer. We're trying to track and just look at her ovaries as close as we can. So unfortunately, we had to go to battle with this insurance company. But I tell women to do as much as you physically can to try to prevent or just do what you can to make sure, to hopefully not get ovarian cancer. Yes, it can. BRCA1 and BRCA2 genes, and that is BRCA gene test 1 and 2. So the one thing that everyone should know is that everyone is born with a BRCA1 and BRCA2 gene. Everybody has that gene in their body. What they are testing for in this gene test is to see if you have what is called a gene mutation. So if that gene is mutated, it now puts you at higher risk for not only ovarian cancer, but also breast cancer can be detected, is known as a higher risk for BRCA1, BRCA2 gene mutation. Now, getting a gene mutation test, they usually test lots of your genes. Depending, you really have to have a conversation with your doctor. This is where insurance companies will try to fight you, especially if you have, pristine health. Those tests sometimes do cost. There are now more organizations and hospitals and health systems that are doing trials. For example, I was a part of a trial just a couple of years ago, and my gene test was completely covered underneath this health system's trial. So I was able to get the BRCA1, BRCA2 gene tested. Thank goodness I don't have a mutated gene, but I still have to be on alert, because just because you don't have a gene mutation, you could not have the gene mutation. Your CA125 can be normal. You could be doing everything right. You could be eating right, exercising, doing everything right. You could still be at risk to get ovarian cancer. The healthier you are, it does help. So if you do get that cancer or any health condition, if you are a healthy individual, you're eating right, you're exercising, getting the right amount of sleep, your stress levels are low. That's a huge part of staying healthy, is stress, and having that reduced, which is hard during a pandemic, but we have to try to do as much as possible. But it will help you in your battle if you do have to face ovarian cancer or any cancer. But unfortunately, I can't come here on the screen today and say, oh, if you do these 3 things, you will never get ovarian cancer. So there's just nothing really there to say that. And like I said, there's still no accurate screening. In my mother's case, I tell women and men to please go to the doctor annually, get your well check, get your physical examination. She just was not one to go to the doctor. She just really didn't like going to doctors. And had she gone, they might have caught, something, or seen that, some of her blood levels were abnormal, or they might not have. But, unfortunately, by the time she did go to the doctor, she was at stage 4. Like I said, over about 80% of the women who are diagnosed with ovarian cancer are already in stages 3 and 4. And with ovarian cancer, you can go from an early stage to an advanced stage within a year. So you might not even know you have the cancer in January, and it's a very silent moving cancer. The National Ovarian Cancer Coalition has a whole campaign saying, break the silence. It could silently move through your body, and you don't know you have it until you're in that stage 3, stage 4. At one point, there was only 14% of women being diagnosed in stages 1 and 2. Now it's 20%. So the good news is it is going in the right direction, where there are more women who are in the early stages, but it's still not enough. It's still a great deal amount of women who are still being caught in those latter stages. In regards to African American women with ovarian cancer, it's really hard to find the mortality rates. But just to tell you how many of us are at risk, 1 in 107 Black women each year are at risk of getting ovarian cancer. And 1 in 140 of us are at risk of dying from that cancer. So that's just puts it into perspective. And actually, we are, it goes from Caucasian, it has the highest diagnosis right now for ovarian cancer. The next are Latino women, Latina women, Latinx. They are the next, then Asian American, then African American women. But the one thing, as I stated before, our cancer markers, unfortunately, they just don't circulate the way they should in our body. So our cancer markers may not show up until later. And that later phase may be what happened to my mother, where she was stage 4 ovarian cancer. When should you seek a medical oncologist was a question that I also got. After you talk to your doctor, in my mother's case, naturally, when she went to the emergency room, she had to immediately talk to a medical oncologist. If they do see that some of your markers are off, that CA-125 is off, if you get that transvaginal ultrasound and they happen to see, your ovaries, don't quite, something's wrong. We see something in the ovaries. It looks more than just a cyst. And they do further testing. They may do other testing and then refer you to a medical oncologist. Again, you want to talk to your doctor about that. And especially if you are experiencing any of the symptoms and they really start to develop more over time with that. So it's with ovarian cancer, because it's so hard to detect this cancer early, sometimes by the time the medical oncologist comes into the picture, you're at the latter stages. And also when you have the gene mutation. If you happen to get that gene mutation, you may want to have just a conversation with a medical oncologist and just talk about, your risks and what you should be looking out for. And they could really just really monitor you a bit closely. So women don't only carry the BRCA1, BRCA2 gene. Like I said, everyone has this gene, but men can also have this gene mutation. And of course, men can't get ovarian cancer. We know that. But men can now pass it along to their children. So when they have kids and they happen to have a daughter, the daughter can now have the BRCA1, BRCA2 gene mutation because of her father. And, it's not really talked about a lot, but with breast cancer, men do get breast cancer. And that's one of the tests they look at is the BRCA1, BRCA2 gene mutation. Even though, I have a son, I don't have the gene mutation. I don't know if my mother had it, but my son could carry the gene mutation and he can now pass it along to when he has children. So that's just another example. So it's not just, I tell the men, that you have to be cautious as well, because if you have women in your life or a daughter in your life, or even a son, you want to make sure that they're now tested for the BRCA1, BRCA2 gene mutation as well. In regards to treatment with ovarian cancer, my mother and, a lot of women, like her go through chemotherapy. She had an oral drug as well that somewhat assisted or helped with the cancer. You have to be very careful. I'm so thankful that Shelly was on and talked a lot about, really talk to your pharmacist. They know a great deal. One of the medications that my mother was on, unfortunately, she started having other symptoms. So she already had an array of symptoms, and now she was experiencing tightness in her legs, and she started noticing it was creeping up to her thighs. Realizing, I'm on this, I'm doing chemo. That's one thing. I'm on this other medication. And long story short, one of the medications that she was on was causing blood clots. So thank goodness, she talked to the doctors and we talked, to the pharmacist, and they took her off of that medication. But now she had to be treated for blood clots on top of everything else. And she had to get a procedure done to get a mesh with inside her body to prevent those blood clots from going up into her body even further. So one thing to really, also talk about, there are different ways that women are treating ovarian cancer right now. A lot go through the traditional chemotherapy approach, as I stated. A lot are going through the integrative health approach. I know the Cancer Treatment Centers of America are really big on doing integrative health approaches. And what is integrative health? That is when they are integrating not just traditional medications, not just your traditional chemo and the oral drugs, but they're also doing, integrating some of the holistic approaches, or they may be integrating a vitamin IV infusion or detoxification processing, which means you may get colon hydrotherapy or infrared saunas. They're doing a lot now to, more than ever, to help women try to beat this cancer. Some go, and they also bring in herbalism and herbalists. And there are certified herbalists out there as well. They're more, in the holistic realm. And there's lots of centers. Like I said, there's Cancer Treatment Center of America. There's the Invita Center. They're out in Arizona. And there's other centers that really believe in bringing in this holistic approach to help not just the cancer patient, but also their family, because caregivers like myself go through a great deal helping their loved ones. So they're there for them as well. And they offer support groups and, whatever support the family may need. And they do accept insurance. I know there was a question about cost. I don't know what the current cost is, because there's so many different ways now that women are treating ovarian cancer. But when my mother went through her 6-month battle between August 2009 to February 2010, and I saw just one hospital bill. She was between two hospitals and the nursing home. I never saw the nursing home bill. One hospital bill alone for her 6 months off and on with them was $125,000. Now, thank goodness she had insurance. She actually had Medicaid at that time, and the only bill we saw that we had to pay, because they'd show you what it would cost and what you have to pay. The out-of-pocket cost for her was $25, and they wrote that off. But it is really critical for women and men to have insurance, because what if you do not have insurance? You can file for emergency Medicaid depending on your income. And, they will, work with you. But there are some women who are seeing astronomical bills because they are treating ovarian cancer. And depending on the insurance company, they're not picking up the whole tab, or they're not picking up. In my mother's case, it was almost 100% of her bill was covered. So this is where, it does depend on your insurance, especially if you're going the integrative health approach, the holistic approach. Some insurance companies don't necessarily believe in covering that. They want to see that it's been clinically tested and has been proven to help women with ovarian cancer and GYN cancers as well. There are some ways to help decrease the risk. Pregnancy is one. They say if you become pregnant and have children, it does lower your risk of getting ovarian cancer. If you breastfeed your child, that lowers your risk as well. And oral contraceptive use, meaning birth control pills. It's been shown through the American Cancer Society and other places too, like the Center for Disease Control. It lowers your risk by 35%. One of the ways that increases your risk is, family history. If you have that gene mutation, if you're in menopause, postmenopausal, and now women who are over the age of 40, it's been actually lowered to 40, are naturally put at risk. Some other preventative ways that women are now totally preventing any GYN cancer from, from coming into their life. And this is the extreme approach. And some insurance companies are approving this. If you have a gene mutation, for example, you now have proof that you are at very high risk of getting, ovarian cancer, for example, or even breast cancer. Some women are opting to get full hysterectomies, to just say, I don't want to deal with this. I either don't have kids or I'm done having kids. Just take it all, so that way I'm at zero risk from getting any gynecological cancer. And there's now more and more women that are going that route because they just don't want to deal with, ovarian cancer and GYN cancer at all. So with that, like I said, of course, early detection increases survival rate. A pap test, unfortunately, does not detect ovarian cancer. My prayers is that one day they will come up with accurate screening for ovarian cancer. Right now, we're in 2021, and they still don't have accurate screening for this cancer, which is pretty frightening. But still, get your annual exam. If there are any women here that are on Medicaid, I just want to say something that I've learned through my doctors is that Medicaid is now trying to tell women, okay, if you have a normal annual exam, so you go, everything's normal, we'll see you in 5 years versus annually. So they're trying to push women away from getting their annual exams done and getting them done every 5 years. As I stated, ovarian cancer can show up in January and move through your body quickly by the end of that year, and it could become an advanced stage. So you want to make an appeal to your doctor that, no, I need to get this test done annually. Advocate for your health. That's why I advocate for ovarian cancer awareness and women with GYN cancers and their loved ones, because now some of these insurance companies are trying to say, if you have normal results, we'll just see you in about 3 to 5 years. And a lot can happen in just 12 months. With Jen, when she talked about this month, is Go Red for heart disease. The month for GYN cancer awareness and ovarian cancer awareness is September, and the color is teal. That's why I have a lot of teal on today. And January was actually Cervical Cancer Awareness Month, and their color is also teal as well. So I hope I covered everything. My website, like I said, I'm a National Board Certified Health and Wellness Coach. My website is divinewryte.com, divinewryte.com. If anyone has any questions after this summit is over and you think of something, I do have a contact page on there. You can feel free to reach out to me. If there's any questions, I could take a question at this time.
Okay. All right. So we are going to go with your first question. Okay. I had a complete hysterectomy at 37. As it was explained to me, your body is forced into surgical menopause.
Mm-hmm.
It is possible when you hit 50, is it possible to have a second wave of menopause? That's the first part of the question.
Okay.
Do you recommend taking estrogen? If you had a full, complete hysterectomy, no ovaries or uterus, does that rule you out on getting any vaginal cancer?
Got it. Okay. So part one to the question, yes. I had a friend, she'd actually just recently had a surgical, she had a full hysterectomy. Like she said, it forces you into menopause. So it really, that is where I'm in no place. I'm a coach, so I do not do recommendations. I do tell women to talk to your doctor about estrogen treatment and really monitoring your hormonal levels. They have to be now monitored more than ever. That could be done through lab work as well. But I know, for example, my friend was put on a certain hormone, to help with the fluctuation because you are forced. And she said, you go from feeling fine one day to like all the menopausal symptoms, the sweating, the fatigue and everything else. So with that, I would definitely talk to your doctor. A second wave of menopause, I know our bodies naturally change every 10 years. Women kind of go through this hormonal change every 5 to 10 years. When you reach that age, and even before then, because like I said, I'm 46 and I'm dealing with perimenopausal things that I don't want to deal with right now. But now they're telling women at 45 and even 50 to just have those conversations and keep that dialogue open with your doctor about, you know, I already had the surgery in my late 30s. I'm in my now 40s or 50s. How can I keep my levels kind of balanced so I'm not going through this other wave again? I will say I have people I've talked to who are in their 60s, had the full hysterectomy 10, 15, 20 years ago, and they feel like their body's going through a whole other shift. And like I said, it's natural for your body to go through these shifts every 5 to 10 years, but really have a close connection with a health practitioner and a doctor so you're not suffering through this. So I hope that answers her questions.
Okay. Is ovarian cyst linked to ovarian cancer?
Uh, what they do is, so the answer is if you have an ovarian cyst, you don't either necessarily have ovarian cancer. For me, I have a cyst in each of my ovaries, and I do not have ovarian cancer. What they do is because my mother passed away from ovarian cancer, even if she was alive today, I would still be considered high risk. They monitor you a bit more closely than a woman who has no cyst in her ovaries. Her reproductive system looks totally fine. She doesn't have endometriosis, she doesn't have fibroids, but I tell women, get the CA-125 test, look out for the symptoms, do all that you can, but monitor the cysts. If you do see that they are growing in size and that is now raising red flags for you, talk to your doctor. And I tell women, if you don't like what your doctor has to say, there are millions of other doctors out there in the universe. Please go get a second or even third opinion. And you can either, some women get the cyst removed. It really depends on the age bracket. Some women decide to get their ovaries removed altogether, but it depends on the size of the cyst. But no, it does not mean you have ovarian cancer. It just means you have a cyst in your ovaries.
Okay. Are there any more questions or comments? Okay. The other comment is, this was very helpful for us all. Can you please type your information in the link for us in the comment section? Thanks.
Will do.
Okay. So if we do not have any more questions for Serena Wills, what we will do is take a break at this time. But if you do have any questions, I will be sitting right here to read them for you. Okay, but other than that, we are going to take a break at this time, and we are to resume around let's see here, 1:25, and we will have our other presenter. Okay. All right. You need a what? All right, so we are back, and we're going to get started with our next presenter. And our next presenter is Ashley Smith. She's an RN and she has a BSN. Her topic is my underlying medical issues in the fight COVID-19. Ashley Smith, take it away.
Hi, how's everybody doing today? I know everybody's on mute. It's fine. Thumbs up.
Hi, Ashley.
Little wave. That's good enough. Hi. Can I share my screen? Because I do have a PowerPoint.
You can.
Okay.
1 second.
Okay. So I can share now. Ready? Okay. All right. Thanks, April. So like April said, we're going to be talking about pre-existing conditions and the fight against COVID-19. Uh-oh. Okay. So first, I'll do a little introduction. My name is Ashley Smith, and like April said, I am a registered nurse. I have been working in healthcare for 16 years, but I've been a nurse for 14. Ultimately, my goal is to utilize holistic nursing practices to improve the overall health of my community of Black and Brown people. I have experience in many different areas of bedside nursing in the hospital. I practiced in the hospital for maybe a little over 10 years. I've worked in the ICUs, I've worked in maternity, I've worked everywhere in the hospital. I've touched almost everywhere in the hospital. I'm a busy bee, I don't like to be bored. So when I was working in the hospital, I was a float nurse, so I was able to get a little bit of everything. I also have some experience being an educator. I taught at an LPN school for some time. Currently, I am the director of nursing for a home care company and the health chair for SBC NAACP. I am also the owner and CEO of the Healthy High podcast, which is a podcast that I created to educate the African American community. And I'm a family girl. I love spending time with my husband and our 3 children. So what is COVID-19 and how does it spread? I think a lot of us probably know the answer to this because it's been around. We've been talking about this for almost a year now, right? So COVID-19 is a strain of coronavirus. COVID-19 is highly contagious virus that travels via respiratory droplets from a person that is infected. These droplets can land in the mouth, nose, hands, on surfaces, and can also be inhaled. So how does it spread? Person-to-person contact, and if you are in contact with a contaminated surface. So that's why we talk about social distancing, wearing your mask, washing your hands, all those wonderful things. Most common symptoms of COVID-19. First, I want to say that the symptoms usually appears 2 to 14 days after you have been exposed. The most common symptoms, my symptoms are just scrolling. I was supposed to change that. The most common symptoms are fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle, body aches, headaches, and new loss of taste or smell. So a common question that I get a lot is, how do I know if I have the flu? Sorry, misspelling. The flu or COVID-19. You really don't know because a lot of the COVID-19 symptoms are very similar to the flu symptoms. So my recommendation is that you always get tested. Me personally, I get tested every single month because as a medical professional, I just feel like it's important. I go and I visit people in their homes. So I don't want to introduce anything to anyone. So even if I don't have a symptom, I haven't been exposed, anything. Every month I go and I get tested, and it is simple and easy to get tested. So if you ever have an inkling, a thought, a feeling, go and get tested. It's better to be safe than sorry. All right, so who has COVID-19 affected the most and why? So according to CDC, there is increase in evidence that racial and ethnic minority groups are disproportionately affected by COVID-19. So the CDC defines racial and ethnic minority groups as people of color with a wide variety of backgrounds and experiences. So what are some factors that contribute to the increase in the racial and ethnic minority groups is what they're calling it, but it's really Black African Americans, brown and Black people, right? So the factors that contribute to increased risk is number one, the biggest thing, discrimination. We have a racist healthcare system, and it is a very big problem. The second is healthcare access and utilization of healthcare access. Because of our racist healthcare system, and we have extensive history that tells us that our healthcare system is racist, we don't want to utilize it. African American people don't want to utilize the healthcare system. The other issue is healthcare access. Because of our inequities, we are less educated, and it kind of rolls over into not being able to get a very good job that provides us with very good access to healthcare. So that can become a problem. We also are limited to maybe transportation to get us to and from a doctor. We maybe don't have childcare. Some other issues that we could have is that we could have a job, but we can't afford to take the time off to go and access healthcare, because if we take the time off, it may penalize, it may, prevent us from getting paid or stuff like that. So we may not want to take time off. And then communication and language barrier can also be a problem. Occupations, as much discrimination as African Americans have against us, we are majority of the essential workers. So because of that, it puts us at a greater risk, because we are outside, we're dealing with people, we're coming in contact, we're the grocery workers, we're the taxi cab drivers, we're the nurses, we're the nurses' aides, what have you, whatever is essential. Some of us are police officers. Our occupation puts us at an increased risk. I mentioned this a little bit already. Education, income, wealth gaps also puts you at risk because of our inequities in access to higher quality education. It limits our future job options, and it leads to low income jobs and less stable jobs, and obviously wealth gaps. And then housing. A lot of African Americans live in crowded housing, multi-generational housing, and again, we can't afford housing, so some of us are homeless. So all of these are some factors that puts us at an increased risk. So let's get into some pre-existing condition. First, we're going to define what a pre-existing condition is. So it's a health problem that one has prior to any new problems, illnesses, or conditions. So anything that you may have, God forbid you contract COVID, anything that you had before you contract COVID. Certain pre-existing conditions increase your risk of severe illness or even death when combined with COVID-19, which is what we've kind of been hearing already, right? So these pre-existing conditions include cancer. They include chronic kidney disease, chronic obstructive pulmonary disease, Down syndrome, heart conditions. So underneath your heart conditions, that's your hypertension, that's your heart attacks, that's your strokes, immune compromised states, obesity, pregnancy, sickle cell disease, smoking, type 2 diabetes, and asthma. So now of these pre-existing conditions, I can tell you that African Americans get cancer We get heart conditions. We get chronic kidney disease. A lot of us are obese. Sickle cell is a genetic disease, and it's genetically predisposed to African Americans. Type 2 diabetes is another one that we get often as African Americans. And yeah, asthma, so-so. Okay. So most common pre-existing conditions identified in African Americans. So heart disease is such a problem for our community. So like I mentioned before, heart disease includes hypertension or high blood pressure, coronary artery disease or atherosclerosis, which is when you eat fatty foods, your arteries get full with a whole bunch of mumble jumble, and it makes it difficult for the blood to pass through. And that increases your risk for a heart attack or a heart attack, or myocardial infarction is what is also called, MI. And then stroke. So a stroke is when we have a clot that goes to a part of the brain, and it blocks the brain from getting the blood that it needs to work. And so it stops functioning for a period of time if we can catch it early enough. Diabetes, oh my goodness, is another very, very big problem that African Americans have. Most of us know that diabetes is from having an elevated amount of sugar in your blood. And your pancreas is not producing enough insulin or none at all, right, to break that down. So diabetes is a big problem. Obesity is a big problem that we have in the African American community. We are not eating right, we are not taking care of ourselves, and it is a pre-existing condition. And cancer. All of us, what I will say about cancer is all of us have cancer cells in our body. In some bodies, they grow, in some bodies, they do not. Environmental factors can dictate if those cancer cells will grow in your body. Environmental factors meaning maybe living by a gas station, having bottles that are not BPA free, using perfumes, using certain makeup has cancer causing things in it. So it has a lot to do with environmental factors because we all have cancer cells in our body, but cancer is a major problem for African Americans as well. So how do we fight against COVID-19? Social distance, which is what we've kind of been hearing a lot about already. Wearing a mask and hand hygiene. When it comes to hand hygiene, I know everybody's using these hand sanitizers. Use your hand sanitizers a max of 5 times, and then please wash your hands because it just builds up and it's not good. Invest in your spirituality. I don't know if it's God, I don't know if it's your ancestors, whoever it is that you pray to, you worship, you meditate, invest in that. Take time, schedule time to invest in your spirituality. Change your dietary habits. Eat on the rainbow. Eat 6 to 8 servings of fruits and vegetables daily. Increase your water intake. Stop with the sugary beverages, stop with the coffee, the juices, I don't know, whatever. If it's not water, don't drink it. Stop eating processed foods and trans fat. Our African Americans, we have grown up and learned to live on processed foods, which is why we have all these other issues. They keep saying that this is predisposed to African Americans. It's in our genes to have diabetes. There's no such thing. Sickle cell disease is a disease of your chromosome, of your genes, your actual genes, right? That's something you cannot prevent. Diabetes, hypertension, we can prevent those things if we just eat right and exercise and do the things that we need to do to maintain our health, it is 100% preventable. So I do not think it's a genetic thing. I think it's just what we've been taught by our families, and we're passing it down in that sort. So we just need to change our behaviors. Eat only lean meats or a whole food plant-based diet. So I know when people hear a whole food plant-based diet, they start going crazy. They can't do that. There's nothing to eat. They can't eat salads all day. That is not true. We need to get away from eating the meats, because the way that the farmers and they're growing the meat, they're injecting them with so much hormones and carcinogens, cancer-causing things, that we really need to try to get away from eating meats. Social drinking only, or if you can, no alcohol. Exercising is a way to fight COVID-19 because it helps to boost your immune system. Getting vitamin D is a good way to fight against COVID-19. And the best way to get vitamin D is to go out and walk in the sun. So you can get your exercise and you can get your vitamin D at the same time. I'm a nurse, but I don't love to push pills. If you take vitamin D pills, that's fine. But if you can just get out every day, even if it's twice a day, maybe in the morning before you leave to go to work, maybe if it's not too dark when you come home, just to get outside 20 minutes, that's very good. Another thing that people don't know about vitamin D is that in order for vitamin D to be absorbed, you have to have calcium in your diet. Vitamin D is facilitated into your cells by calcium. Calcium grabs vitamin D and says, come on, I have somewhere for you to go. So without the two, it won't work. So if you're not getting enough calcium, but you're going out in the sun and your vitamin D is still low, that is a problem. You must consume calcium with your vitamin D. Okay, and get 6 to 8 hours of sleep daily. Sleeping 6 to 8 hours a day increases your the capability of your immune system to work. So these are some of the things you want to do to naturally try to fight against COVID-19. Oh, I have another one here. Try natural supplements like sea moss or elderberry. Sea moss is, I don't know if it's a new phenomenon or maybe it's just coming back, but sea moss has 92 of the 102 minerals and vitamins that you need for your cells, which is the smallest part of your body to function, right? So a whole bunch of cells make up a part of your body, and then each part of your body make up the whole entire human. So at the smallest level, we have to feed our cells. So sea moss is good for that. And elderberry, they say, is also good for like flu-like symptoms and stuff like that. So I'm assuming it probably helps with your immune system. Sea moss comes from sea, like the sea. It's like seaweed or something like that in the sea, and elderberry is an actual berry. How can I advocate or stand up for myself in healthcare? So the first thing I would recommend is to educate yourself, right? We have a racist healthcare system. I can't say that enough, period, point blank. The healthcare system is racist. And what I've learned is that it's a subconscious prejudice, meaning that the people that are racist in healthcare don't even realize, because it's been passed down for so many years and it's been normalized behavior that they don't even know. So until we figure out how to eradicate that, we have to take care of ourselves by educating ourselves. We have to know what we're getting into so that when we start hearing jibber jabber from someone else that we feel is being a little racist or not understanding or not taking our thoughts or how we feel seriously, we can speak up for ourselves. So the best way to educate yourself is obviously reading, right? You want to get reputable books and reputable websites that you can look at. as far as reputable websites, you always want to make sure that it ends in .gov or .org, CDC, or your state's website is perfectly fine. The new wave is podcasts to educate yourself. I, again, have a podcast, Tune In. You can just Google anywhere, not Google, in the search bar on any platform that you listen to, whether it be Apple, Google, Spotify, iHeartRadio. You can just search the Healthy High podcast. I've been doing it since about like October. I enjoy doing it. I educate my community on things that's affecting them the most. All right. So if you have a chance, any podcast is a good way to educate yourself. And if you want to Google, smoogle, look up peer review articles, that's another way to educate yourself. Another recommendation that I would say on how you can advocate or stand up for yourself is to join an organization that represents you and can advocate for you. Some examples of that is the NAACP, the National Urban League, Black Women in Sisterhood for Action, and Color of Change. Another thing that I could recommend that's not here is utilization of the internet. If you're in a healthcare setting and you do not feel like you are being taken seriously, utilize your social media. That is becoming a very, very big thing. Unfortunately, there was a physician, an African-American physician that recently passed away from COVID, but she utilized her social media to let people know what was going on. And she's a doctor, and she was being discriminated against in the hospital. So that is just about it. I don't know where my time is. Okay. So I can take some questions now, if anyone has questions.
Okay, ladies, if there are any questions, I'm going to go ahead and open up the chat so I can start reading the questions to Ashley Smith. Okay, so I know that there was a comment here and it did follow with a question. The comment was, the hours of sleep has been difficult for the last couple of months. The night sweats disrupt the whole night. And then the question was, has anyone ever heard of Ambien for women to take for night sweats?
Ambien? Is that Ambien? As far as
Ambien, yeah.
Ambien is something to make you sleep at night. I don't know if it'll be controlling the night sweats. Might I ask, what are you getting night sweats from? Okay.
Menopause.
Okay, that's not my area of expertise so much, but I would say look into your diet. I think you need to figure out how you're eating. I think you need to start looking up some herbs that could help you with the symptoms of your menopause. Look into some foods that may trigger you. Pay attention to your body. When you eat certain things, do you realize that you're sweating a little more at night? Do you realize that you're going through more hot flashes when you have that specific food? And then maybe stay away from that food. A lot of the things that we ingest dictate how our body is feeling and reacting to certain things. So I would recommend that. I don't know if that answers your question or makes sense.
Okay, to go back to Ambien, Amberen. So again, that's for women to take for night sweats. Has anyone ever heard of that for night sweats?
I'm sorry, I thought it was Ambien, like, you know.
Yeah, she said Ambien.
Oh, okay. No, I don't know about it. I don't.
Okay, are there any other questions? Because you have received a lot of information about underlying diseases and COVID-19, what you do to advocate for yourself. Mm-hmm. Okay, so it seems like your presentation was awesome
Crystal
because
clear,
you
right?
have no question here. Yeah. Okay, so if there aren't any questions right now, just remember before we conclude for the day, we will have other questions. Okay, here's a question now. How are we able to get response for this COVID-19 vaccine? Okay, response. She applied online, but no response.
I would check with your state. I would check with, usually the state is updating you regularly on what is going on with COVID-19 vaccines, where it's being given out at. You probably be able to put your zip code in or something of that nature to figure out where you can get vaccinated at. I don't know much about the vaccine because I'm not taking it, so I don't do so much research on it. But I'm sure the state's website will have like updates on, like, you know, I know they're going to be rolling out maybe Walgreens or CVS or the doctor's offices. They should keep it updated very, very regular.
Okay, so there's two questions for you. Sunscreen SPF 30, when in the sun getting vitamin D. So to mention that about the importance of sunscreen SPF 30 when in the sun and getting vitamin D.
So I think Black people in general, me included, we think we don't need sunscreen. You need sunscreen, okay? Sunscreen does helps prevent you from getting skin cancer. So that is very, very necessary when you're getting out in the sun. Okay, don't forget that. Even though you need to get out in the sun, you still need your sunscreen.
Okay, what are the best forms to take the sea moss and elderberry?
The elderberry usually is a syrupy liquid, and you can infuse that in any food, or if you take it straight up, that's up to you. It's pretty easy to ingest. Sea moss usually comes in like a jelly. It's so simple and easy to make at home. Actually, if you can find a place to buy the actual sea moss from, you just soak it overnight, 12 to 24 hours, and then put it in the blender. And depending on the amount of water that you put with it, it depends on the consistency of it. So it could be liquidy or it could be more of like a little gel. For me personally, I like it I like mine's gel, but I make it liquid because I have to put it in my kids, sneak it into my kids' stuff. And when it's jelly, sometimes it doesn't dilute like it does when it's water. So sea moss, you can put it in your soups. I put it in shakes. I put it in my kids' juice. I put it in my tea in the morning. You can get it anyway.
Okay, is the calcium you get from dairy products sufficient amount?
It should be. Yes, it should be. You want to always check the back of your labels. So someone always taught me the front is for entertainment, the back is for information. So you want to check the back of those ingredients to make sure that it has a good amount of calcium in it. But eating on the rainbow can help with all of that, because there are some people that eat plant-based, so they do not consume milk and dairy products. If you eat on the rainbow, your fruits and your vegetables have all that you need in it. You don't need this milk. Milk is just pus from the cow. So just be mindful. We have to learn to start being more mindful about what we are putting in our bodies.
Next question. If you have hypothyroidism or hypoparathyroidism, does that put you more at risk for COVID?
So far, nothing has come up about that. COVID is still very new. So I have not come across anything with that, but sea moss will help you with that, with the hypoparathyroidism.
Okay.
And it's a natural way.
All right. And I have in the chat, thanking you for the information regarding COVID-19. And then also thanking everyone for the response regarding the info on Ambirin. Okay, so if there are not any more questions, and if you think of any more questions at the end of the presentation of all presenters, please know that they'll still be around to answer any questions that may come up as we proceed. Good information, no dairy, fruits, and veggies give you all you need. So this is another presenter that we actually going to have tomorrow. So yes, she is correct. No dairy, but fruits and veggies definitely will give you all you need. Okay, thank you. And then we're going to proceed, if we don't have any more questions, and moving on to the next presenter. So, I do have another question. Oh, sorry. Sorry about that before I move forward. Okay. All right.
Information is developing on that. Okay. And what I will say is I have a few people that I know that have post-COVID side effects. I have a coworker that still every now and then, and she had COVID about 5 or 6 months ago. And she still every now and then her food tastes a little weird. And she's having some headaches more frequently than she was having before. So that is a real thing. There are some issues with post-COVID side effects. That's scary. There's nothing much I can say about that except try not to get COVID. And you know how you do that? You boost your immune system by getting your vitamin D, you eat your fruits and vegetables, you get your sleep, you drink water, and you work out. 5 things that you don't have to pay for. It's not artificial. Just boost your immune system and pray, and you're good.
I would highly recommend that everyone tune into Ashley's podcast. Her information is actually, she did provide the email address, but if you can also put in the information on how to get to your podcast in the chat will be great. Because again, you want to be in a position where you're able to ask healthcare professionals questions, because at times, let's go back to just basically sitting in the doctor's office. You're sitting there and your nurse is actually your point of asking a lot of questions, because when the doctor comes in, if this is familiar to you all, it takes 15 minutes and they roll into the next person. Mm-hmm. Sometimes they don't want to engage and answer your questions. I'm not going to generalize all doctors, but I want you to understand to use your superhero in front of you, and that is your nurse. Your nurse is the frontline person. Your nurse is the person that knows a lot. So I do encourage you to make contact with your nurse, ask the questions. If your nurse don't know the answer, you better believe she's going to go find it, or she's going to tell you where to go get it. Okay, so for all my nurses, big up to all my nurses. And if there are not any more questions at this time, we will thank Ashley for her presentation, and we will move on to the next presenter. Okay, so our next presenter is Tonia Lennon. She is also a nurse as well. So her presentation today is where it starts with breastfeeding, mom and baby. So take it away, Tonia.
Hello, everyone. Thank you for having me today. I will be talking to any new moms out there, second-time moms, third-time moms who are looking to breastfeed and have a successful breastfeeding experience, okay? So my name again is Tonia Lennon. You can say Tonia Lennon. I'm a registered nurse. I'm also a certified lactation counselor, okay? I have a little over 12 years of nursing in different specialties such as psychiatry, maternal child health, substance abuse, and most of all, I love breastfeeding. Okay, when I say breastfeeding and why I chose this area, because with the low numbers of brown and black moms that's breastfeeding, it's very saddening. Okay, researchers broke it down with the 83 percentile of in the United States. It's 85% of white women and 69% of Black women, leaving a 12% of disparities. So we're asking ourselves, why is this happening? You know, just on a personal note of us, like sisters who's helping other sisters with breastfeeding. Why is this happening? Is it the lack of knowledge that we have with breastfeeding? Is it the maternity care practices supporting breastfeeding in our environment, like in the larger Black populations? The returning of work. So with Black moms, we have to return to work sometimes earlier than other moms, such as white moms, due to financial needs and having to bring more money into the households, right? And then there's that lack of peer and family support. So now when we talk about the family support, it makes me say, okay, well, did my mother breastfeed? Did my grandmother and my great-grandmother breastfeed? Back then, we didn't have consultants. We didn't have lactation counselors. They got the babies to the breast. However, they weren't in the professions that we are in now, right? They're not in the careers that we have now. They're not in the workforce like most moms are now, you know. And then also we have more single mothers out there now who has to go out in the workforce and take care of the kids financially than doing care as a breastfeeding. Okay, so now let's start with the pointers that I want moms to take when you have decided you want to breastfeed your child. Okay, when you choose your doctor is affiliated with the hospital, right? You're going to let that doctor know, I want to breastfeed my child, right? Now that hospital is going to be a baby-friendly hospital initiative. So they're going to implement practices that protect, promote, and support breastfeeding, right? So you should have a certified lactation counselor, and there's going to be also a lactation consultant, okay? Use us, use the consultants, express your concerns, express your needs, show them and demonstrate what you know. Ask questions and let them know what you don't know so you can be helped. Don't wait until you get discharged from the hospital and then decide, oh, you know what, I didn't learn enough, I'm just not going to breastfeed. We have to pick up these numbers. We have to get our newborns on a healthier path, okay? Some things we can't blame on others if we don't take the initiative to do what's needed, the actions, meaning breastfeeding, okay? Another pointer I wanna point out to moms is, you know, we traveling right now. Some moms live in New Jersey and they may work in New York. A lot of people are doing traveling now because of the COVID. So some people have to go and travel out to their parents. You never know. You just may be food shopping, an emergency can happen. EMS is called. Now you're taken to a hospital that's not affiliated with your doctor. Your doctor is not affiliated with this hospital. So now you're at a hospital who knows nothing about you. But if you're carrying that lab work with you, it's very, very good. And why I say that is because now there's no time wasted of saying we have to pull all these important lab works from mom in order to say, no, you know, you have to wait for breastfeeding because we have to make sure certain labs is okay. So mainly there's going to be your blood type. They'll have one, your HIV status, your hepatitis B status, your RPR status, which is syphilis if you're active for syphilis. So mainly the HIV and the hepatitis B are the most two that can hold up your status to breastfeed, your start to breastfeeding. Okay, so the benefits of breastfeeding, the benefits to becoming exclusive breastfeeding. So when we say breastfeeding, this is a mom who's decided, I want to breastfeed, right? It could be possibly up to the first 6 months of baby's life. And then we have the exclusive breastfeeders who mom decided, I don't want nothing else, no other fluid to touch my baby's mouth, only but breast milk. Okay, so the benefits. It's the ideal nutrition for newborns, okay? That first thick fluid, sometimes yellowish, is called colostrum, right? That colostrum is loaded with nutrients and proteins and vitamins. I mean, loaded with so much substantial that you can't even, you can't state it as being an ingredient because it's not mixed. It's coming from the body. It's natural, right? When the baby is gaining more colostrum, they're stimulating mom's breast. More stimulation will pull more colostrum, okay? More stimulation. So you know the saying, if you don't use it, you lose it, and that's what will happen. You will not stimulate the breast if you're not putting that baby to the breast, okay? This is going to help, that colostrum is going to help the baby to fight off bacteria and viruses, okay? So say if the mom receives some type of, or somehow gets some type of bacteria infection, a virus, this is when the antibodies are going to kick in. It's going to cross into the milk. The baby receives immunity, okay? So this is amazing that the body is fighting off some type of infection, but it's also passing over antibodies that's going to help my baby, to protect my baby, okay? It's going to help the baby to get this protective layer, right? This layer is going to protect in the baby's nose, the throat, the digestive system, okay? These are all the areas that formula cannot do this. Breastfeeding, okay, breast milk is what gives the baby this immunity. So now for as of the exclusive breastfeeders, these are moms who are dedicated. They're putting that baby to that breast every 2 to 3 hours, okay? This is going to reduce the risk of allergies and asthma. They're going to have fewer ear infections, fewer respiratory illnesses, bouts of diarrhea and regurgitation, okay? Fewer hospitalizations, lower trips of going back and forth to the pediatrician. This also reduces the risk too of having SIDS, sudden infant death, okay? It's going to also reduce diabetes, okay? With exclusive breastfeeding, it also helps to manage a healthy weight compared to formula that babies mostly become overweight early, fast. The stomachs, the bellies are stretched. Another factor benefit with exclusively breastfeeders is that it's proven that they are smarter, believe it or not, okay? Now for moms, the benefits for them is that we get to lose the weight. We're breastfeeding, the uterus contracting. The uterus now can come to its normal size and come back into place. All right. So now we hear this a lot with our moms, especially our brown and Black moms. You know, I'm not getting no milk out. I don't know if the baby is receiving anything. How do I know how much the baby is receiving? It's to the point, moms, now. Let's stop having these excuses, mom. Let's get these babies to the breast, okay? Utilize your nurse, utilize your lactation consultants, and get these babies to the breast. If the baby is sleepy, we hear this often, which normally the babies are very sleepy. So what you're going to do, you're going to give skin to this infant. You will unswaddle the baby, take t-shirt off, no hats, okay, baby only in pamper. Mom, you will unrobe, no nursing bra, no t-shirt, anything. The baby's going to be directly on you, skin to skin, okay? So what's going to happen is the skin to skin is going to help stabilize the baby's temperature. It's going to help to stabilize baby's heart rate. It's going to help the breathing rate, and also it's going to help the baby's blood sugar, the glucose levels, okay? When the baby is on mom's skin, the baby tends to root, meaning the mouth. They're searching. They know they're at home, right? Those glands around the nipple has a sense of the amniotic fluid. Okay, so this is what brings babies to these areas. It's helping to wake the baby up to say, oh, it's time to feed. Okay, there is no rush to have to put a bottle to the baby's mouth. You have up to 24 hours before deciding that, do I really need to supplement my baby with formula? Okay, so skin to skin is what's going to help you within that time frame before you make any type of decisions. And even if you do have to make that decision to supplement, we have other methods besides putting the nipple to the baby's mouth, such as syringe feed, which we do drops to the baby's mouth. Okay, then there's cup feeding. Babies do take from little medications, cups, okay? And then there's spoon feeding, all right? So the baby is not gonna starve. They had enough fat on them to help them get through this, okay? As long as that baby is doing some good peeing and we see some pooping, mom and dads, you can feel the baby's fontanelles to see if it's a sunken fontanelle. If it seems like it's different, it's sinking in. So these are signs that I'm telling you that you will look to say, maybe the baby may be a little dehydrated. It may be time for me to give more, right? Look at the membranes of the baby's mouth. Usually they do start off a little dry, but within a couple of weeks of time, that should subside because the baby should now be getting a little more from you. Okay, another thing to look for if you want to see if the baby is getting enough, when the baby voids, when they pee, moms will, they go crazy. Oh my gosh, the baby has peed blood. Oh my gosh, what am I to do? It's not blood, mom. It's concentrated urine, okay? Sometimes it can be so concentrated that it looks like powder, like red powder, okay? This is the baby just telling you, I need more. So for breastfeeding moms, if this should happen, you're now going to go from the 3 hours to the 2-hour time frame of putting the baby to the breast. Okay. Another important thing I would like moms to do is to have your physician to give you a prescription ahead of time to order your breast pump. Now, most and all insurance companies do pay for breast pumps. You hear the excuses of moms saying, our brown and Black moms, no, I don't have the money to purchase a breast pump. Well, insurance companies do give you, by law, they will either give you one by rental, or they will purchase that breast pump for you. And some insurance companies even give you hospital grade breast pumps. Okay, so if you're going to be breast pumping, mom, you will be pumping still again as if the baby was on the breast every 2 to 3 hours for 15 to 20 minutes. Okay. Another item that is very good for the mother is called the haka. It's a silicone device that looks like a little vase, which when you squeeze and you put it to the breast, it suctions and stay on the breast. So if you're breastfeeding on the left side with the baby, what normally happens is that the right side will start to leak. We don't want to lose none of that breast milk. We want it to collect. Okay, so that's what it does. It does a collection for you of breast milk. All right, very, very good device. It costs no more than maybe $9 to $15 to have this device. So that would be good if you wanted to put that item on your registry for your baby shower. Okay, another thing is to have in your bag is nipple cream. Okay, some of the brands out there is called the lanolin. We have the nipple butter balm. We have the Mother's Earth. They have a lot of good nipple creams out there that's safe for breastfeeding. Okay, we don't have to wipe off the nipple cream to put the baby on, but mom, we are not going to have the whole breast glycering with nipple cream. Okay, just a little on the nipples. You're going to let those nipples just air out with some sunlight. Okay, so that nipple cream is going to nourish and rehydrate the nipples from becoming dry and cracking. Because sometimes, you know, with the suction of the baby, it can cause a lot of the dryness. Okay, it can cause a little bit of bleeding. Okay, another item is mother's milk. It's a tea. Moms, we can buy these from most health food stores, sometimes Target, CVS. Mother's milk will help to produce more milk. Okay, we can drink this tea 2 to 3 times a day. Okay, and usually you'll find some type of an increase within 48 to 72 hours of time. It's a very, very, very good thing to have in your cabinets. Lastly, I would say, moms, make sure you have your nursing bra. Okay, you want to take that with you in your bag. We need to have these nursing bras on us by the next morning to help to conserve. We want to keep those breasts to us. We want that breast milk to come in and fall right into play. Okay, we don't want saggy boobs. We want to conserve this temple. All right. So again, nursing bra, moms, make sure you have your nursing bra. Now I'm going to go back to moms who are pumping the breast milk. Never, there's no reason to throw out breast milk. Okay. If you breast pump and you're going to be feeding the baby within the next 4 hours, it's okay to keep that breast milk out on the counter at room temperature. Okay. Now, if you decide to pump and you want to refrigerate that breast milk, you can leave it in the refrigerator at about 39 degrees for up to 4 hours. But some moms do invest in a breastfeeding refrigerator, so it can be up to 8 hours in the refrigerator. Then you can also freeze breast milk, okay? And you can freeze that for up to 9 months, okay? And that's at a 0 degrees. But moms, make sure, please, when you are freezing your milk or any milk, make sure you date and time your milk, because you want to make sure you're putting the newer milk to the back and bringing the older milk to the front to be used. We do not, never, never, ever microwave breast milk. Okay? Breast milk will come to its temperature with running warm water. Okay, very, very important. With the new age group that we have, we like to put things into the microwave. So we're going to destroy that milk. We're going to destroy all the nutrients and the vitamins that the baby's supposed to get from this mother's milk. So again, like I said, moms, we need to, I mean, even if grandmothers are on or aunties are on, we need to get our young brown and Black women to breastfeed more, to get into helping these babies receive the benefits of the nutrients and the vitamins that bottled milk cannot give them. We're talking about we want to have a healthier life, but it starts from the baby. Okay, it starts there. We want to have these less trips to the pediatricians or these late night phone calls when we have to maybe go to work, but the baby is vomiting or the ear infections are kicking in more often. So we have to try to put forth of breastfeeding more, taking it more serious to come up to the levels, to bring our numbers up, because we're just at the totem pole with these numbers with breastfeeding. You know, you have your lactation consultants, you have your counselors. There's News Us. You have a lot of support groups out there, and let me name one of the support groups that I really, really do love. It's called the La Leche League of International. They give you tons of information. They have webinars for different situations when it comes to breastfeeding. Okay, so such as for moms who built so much milk that the ducts built up and it can become like an infection. It's called mastitis, where the breast is so hardened, and it takes a whole regime, a treatment plan to get all of that breast milk out of you. It's very timely, but you have so much built there that it can cause an infestation of just hard breasts. Okay, so that's pretty much that I can tell you for just for the start, because we can go on and on about breastfeeding. It's such a wonderful, a beautiful, natural thing that moms, brown and Black moms, we need to get into this. Let's stop practicing this stigma that, oh, why are you breastfeeding? You know, you need to cover up. It's natural. Okay, it's okay to breastfeed. Okay, they have all different types of things that we can cover ourselves, but still take care of our babies by breastfeeding. All right, moms. So let's get to work and let's use our bodies to help our newborns to become healthier infants to adults. And I can take any questions right now if you have any.
Okay, I'm gonna go.
Okay.
Okay, I'm back. I can hear you now. Can't hear you, April.
Okay, there we go. I was
Okay.
exclusive. I wasn't exclusive. I truly saw the benefit and still do in my son. And I was back into my regular size clothes within a month of breastfeeding him.
Yes.
So
Yes. Beautiful.
of, you know, when you are breastfeeding, you can lose the weight. Can you comment?
Did you ask me a question, April?
Yeah, could you comment more on that? You know, elaborate on the benefits of what happens when you are breastfeeding and what happens to your body.
Yeah, because you know, when you're breastfeeding, you and the baby, it's like exercising. You're using muscles, right, to breastfeed. So in the overall, the body is working up a lot. You're giving off, but at the same time, you're giving in, meaning the muscles that's being used from the baby with the feedings is causing the body to go into like a exercise mode, if I can say that. The caloric intake that you take, the baby is pulling away from you. So this is why they say, moms, it's very important to have your nutrition, your water intake is very important, because the baby is pulling a lot of this from you. Okay, so your diet, again, is also very important. All right.
Breastfeeding, does it also help the cervix go back to natural size?
Yes. So when you're breastfeeding, that's why a lot of moms have cramping when they're breastfeeding, because that uterus is contracting, right? So sometimes mom will stop bleeding and then begin to bleed again because the uterus is contracting. What it's doing is it's finding its course back into place. Okay. Usually the uterus will come pretty much high after you deliver. So the baby, once the baby is delivered and you start to breastfeed, that uterus contracts and it's going to come into its normal size, into its normal place.
Okay. So we have a comment here. This is great. I wish I had this information sooner. Another comment, I love mother's milk tea, worked wonders.
Yes.
Next question is, can you put that resource of breastfeeding in the chat? Thank you. And can we combo feed our babies? Is it beneficial?
Yes, there's no reason why you couldn't combo, do the combo. Like I said, you have breastfeeding moms and then you have exclusively breastfeeding moms. So that will fall under the breastfeeding moms who want to give the baby a little of the supplement. But however, if you do not want to put a nipple to the baby's mouth, because sometimes it can cause nipple confusion. Okay, babies tend to get confused. Well, what is this? This is a nipple from mom, or is this a nipple from the bottle? And it can cause a little disruption there. So some moms, like I said, will do a syringe feed where we give off drops for the baby at the beginning. There's cup feeding with small cups, and there's also spoon feeding. Okay. And then if we're talking about moms as the baby is starting to get a little older, by all means, yes, there's no timing of pretty much when you can start to add another fluid in there for the baby.
Okay. All right. So if there are any more comments, take the time out to put it in the chat. I do want to thank you, Tonia, Tonia, Lennon, for your information today. You brought a lot of information for those that probably didn't even notice, when they had children when they were younger. But as she charged us a few minutes ago, she said the younger women that we know, hey, let's help them out. Let's pass this information on to them because
Yes.
they may not know it. Encourage them to seek out help on to get this information, where to go, how to ask the doctors questions. So this is not just for us, but maybe if it doesn't apply to us, let us pass the information on to the young women that are coming behind us.
Definitely.
Okay. All right. So again, thank you so much. Hello, can you mute your your mic? Mute your mic for us. Thank you. Thank you, Barbara. Okay. All right. As we move on to our presenter, our last presenter is LeShanda Tamika Holman. Now, what she will be talking about today is going to be very, very beneficial for us, which if you look at it, she is going to close out everything everyone was talking about today, which is healthier me, what's good to eat, and let's get up and move. So I'm going to turn it over to Tamika, who is also our co-host. Thank you, Tamika. Take it away.
Hello, everybody. How's everybody? And first, I want to thank all the professionals, the doctors, the nurses, Dr. April for putting this together. Everybody was very informative, and I hope everyone get, if not everything, at least a piece of this information and, use it in good use. I'm 30, excuse me, I'm 47. I have I had three kids. My second son was taken away from me, which this information that I'm going to give you also going to play a part within that too. I'm not a professional. I'm just somebody who is very invested into health and into myself. So with that being said, I want to take y'all through a couple of stages, and maybe we could talk about certain things that may fit you in your health. I want to start off by saying, what's the benefits to exercising and the things that you can get? The first thing is it improves the memory. It will definitely have you focus, aware, and is less chances of you getting dementia and Alzheimer's. Two, it protects you from many chronic diseases. If you develop diseases and stuff later on in life, that means it's curable. That's something that you was taken into your body and invested in, which you caused the damage to your body. If it's replaceable, that means you can fix it. Don't wait until things start bothering you. At 20, we start getting a little more, our metabolism is still up, depending on your dieting. At 30, it starts to slow down. And once again, if you're more invested in yourself, you won't feel it until you're in your 40s, because you can't stop nature, but you can progress more in life than a person that's in their 30s that have low metabolism and deal from obesities and chronic diseases. So it will be a little more harder. I can't force people to do things, but I will highly suggest that you do take an investment in yourself. 3, try to age in your weight management. Try to take days where you say, you know what, I'm gonna switch up my eating. I'm gonna stop eating more unhealthy food and lean towards more healthy food. You start managing it by doing it in the daily. You could do it with your kids. You could do it with your husband. You could do it, because some people can't diet alone. Some people can't.
And exercise.
We usually just stir this
And hydration.
until all is not butter now.
Most of our wind up coming from.
Is that somebody talking? I can't really. Hello? Okay. Oh, try to do a point system with yourself. Give yourself credit for, losing a pound or two. You write down your calories intake. You write down the things you want to get rid of. And when you see things, I'm sorry, y'all. When you see things in the visual, you'll notice that these things are not good for you, and playing them in your head. So with the weight management, try to manage your weight in some way, because I'm telling you, weight will put on so much depression, high blood pressure, all types of things that you did not get from your parents, as doctors would say, professional. I'm not trying to take nothing against it, but that's how I feel. That's just my opinion. 4, lower your blood pressure about improving we spoke on this earlier about heart things. So you have to take into things that's going to make your heart more healthier. Start doing things, get up, start walking. I don't care if you got to walk around your house. There's things you can do that in your home. Some people don't want to go outside. Some people don't want to go into the gym, especially at this time when the COVID is running rapidly. You got a table, you got a chair, you got a couch, you lean on it, you do anything. You can lift your leg up. You're getting old. Your bones are going to start stiffening up. You're going to feel the effect. There's no way you're not. But if you move around more than often, because we get so settled in life, everything, I don't care what it is. It could be a relationship. I'm good. I don't need to do this. I got my man. I eat. We go out to restaurants. I cook for him all day. We do these things and we forget us. We got to cook for the kids. We got to do this. We don't take the time out to say, you know what, let's walk around the block as a family. When you do things together, you start, inspiring one another. You start building each other character and stuff up. And that helps you, with your health. Number 5 is to improve the quality of your sleep. As everybody said, it's natural. You get 6 to 8 hours. I know I can't even talk because I'm one who deprive myself of sleep at times. And that's because sometimes my balance is off, when I'm thinking too much, when I'm doing too much, when I'm not eating right, maybe this week, maybe I went out and had a drink or 2 this week. It does affect you. Some people think it don't, especially when you don't flush it properly, as using water or green vegetables or stuff like that. Some people say, I don't like the way green vegetables. So what do you want to do? You have a choice. You don't want it. You want a bad taste of a green vegetable in your mouth, or you want to get up every morning and have to count your diabetes, your blood, and do things that you don't want to do. I'd rather take the 1 minute of eating a vegetable than taking a lifetime of my blood to see if my blood count is high or if I'm going to have a stroke this week and stuff like that. Number 6, it reduced the feeling of anxiety and depression. You cannot, I don't care what nobody say, when you are off balance, which is your weight, because you're supposed to be a certain weight at a certain height in your life, it throws you off. You start getting anxiety, you start getting depression, and it helps you with depression. You may be going through something. Let me get up and go exercise. Let me punch a bag or 2. Let me walk around the block. It helps. It really helps. Let me free my mind. Let me go do yoga. I get up in the morning and do yoga. People wonder why. Why are you up 5 or 6 o'clock in the morning? I be in here doing yoga. Guess with who? Well, my son, my baby son. We be up doing yoga. It won't fix cancer, but it will combat it. And it does relate to fatigue. Why you always tired? You don't understand. Why am I tired? Why am I sleepy? You just ate a double cheeseburger with bacon and French fries, and you wondering why you're tired? All that weighs on you. These are the things we love. Of course we love it because it tastes good. It's just like a bad relationship. Whatever's good for you is never good to you. You know what I'm trying to say. Whatever's good to you is not good for you. That's what I meant to say. So, and it definitely, once again, would improve joint pain and stiffness. That is the worst part of getting old. It's nothing wrong with getting old, but just don't age as you getting old. Take the initiative to say, this is what I get one time in life. You don't get that. You don't get another body. You get that one time. You have to take care of it. And I'm telling you, meditation and yoga and spiritual will do it because it release you and make you more vulnerable to situations, which means your health and other things. And you start putting that into perspective. And number 1. Number 9 is it maintain muscle strength and balance. Once again, we get older, we lose our muscle strength, our bone, everything just start hurting. Oh, we need a hip replacement. Oh, our knee is things like that. You wouldn't have to put your life in these physician hands if you take care of yourself. And then with that, we have the nerve to take our time to go see what's wrong with us. And wondering why we dropping at an alarming rate. because we're not taking care of ourselves. We're not putting ourselves first. Everything is on the back burner. Everything without us, our household can't run. I don't care how many of our men go out there and bring home. We make this household run. And once we're gone, what's gonna happen? Nothing. If they're gonna live their life, we have to sit there and say, you know what? This is my family. I have to take the initiative. I'm the leader of this ship. Let me change eating habits. Let me do things where we could do it as a family and grow, you know, because life is short, as we all know. And look, this right here, the COVID is a proven fact. It's so many people that's walking around with underlying disease and things, and it's just dropping down. And at first, we was wondering why. Why are people? Because the realization is we're not taking care of ourselves. Since we were young, I want to go back on to Dr. I think Jen, that was her first name, to saying how the minorities and the Black people are the ones with the high rate of high blood pressure and diabetes. Yes, you know why? Because we didn't have the luxury of going into grocery stores and getting the fresh vegetables and the things. Yeah, we had the WIC, but look what we had on WIC, little things like that. We didn't have the economy and the money, or we didn't have the resources as we do now, thank God, where we can stick, you know, eat right. I would suggest, and I wish I could, if anybody have a home, grow your own vegetables and fruit, because you'll know for a fact what you eating. And just like nurse said, Ashley, sorry, they are putting things in our food. It's no way. We knew people growing up from cancer, but at this rate, we knew kids that, just think about it, majority of the kids right now are suffering from autism. Why? We still don't know. It could be something that we don't know. All I know is that it's something wrong in our community. Not saying that it's not happening in other places, but here in our community, we have to make some type of changes, and we do have to start at home and start with our younger kids. And if our kids are growing up at a certain point, it's nothing wrong with trying to give them pointers. Or if you have your grandkids, switch them up, sneak something in their meal, do certain things, prevent them from keeping this cycle going with us eating pork and the leftovers of beef and steroid chickens that they put in our community. We have no other choice at this point, because some of us can't afford to get nothing but put our pennies together and get a $25 meal, which is something that we shouldn't be putting in our body. But instead of taking that $25 and getting things that we know that's hurting us, substitute it for something that we know that can benefit for us. Just like I'm talking so fast, but the food, the base food. Invest in those things. It's things that you can invest. Instead of frying your chicken, bake it. You can do it. I know, I'm a cook. I know. You can bake your French fries. You can do things where you don't have to suffer and not take away from what you like to eat. Because that's the whole thing. Everybody think they're going to miss something. We ate bad for years. What's a couple of years of saving us is going to do? Eventually, we're going to have to stop eating. We're going to have to stop eating them things, because we're going to have blood pressure. You got to stop eating this. You got to stop eating that. Why not do it now? Why not say, you know, I'm going to give my body a fair fight, even if I can't stop things that I get, like diseases and stuff that I might develop, or even hereditary. Maybe I can't stop that. But what I could do is give myself a fighting chance. You can't win if you're off. You can't fight back if you off. You don't wait until you land in the bed with an oxygen tank on yourself saying, well, let's put some ginger in a cup and some oranges and stuff like that. You should be doing that every single day of your life. It shouldn't have to take a airborne or wherever this disease come from to say, let me get my health together. And still we take advantage of that, because we still do things that we're not supposed to do. I know I'm a victim of some of the stuff because we don't want to stop life. But if we don't, we still have to be cautious about how we live life. You know, because We can't, that put a depression on us. And we went through a lot. We overcame a lot, slavery, racism, everything. We gonna overcome this, but we just gotta do it the right way. Yeah, we don't trust the government. Yes, they dealt us so many hands, but you gotta trust yourself. And if you don't trust the government, that's where you come in at and say, you know what? I'm not taking that goddamn shot because I take care of myself. I'm gonna be cautious about my surroundings. I know you're gonna do everything in your power to do it. But at least you'll give yourself that fight to say, I'm not just gonna throw in the towel. That's not how we built. We built differently. We're not built that way. We built the fight. This is why we strong at what we do. We just lose because of the things we put in our body. And we develop diseases and things that we're not supposed to have. We're not supposed to have that. Look at Cicely Tyson. They said to this day, but before she died, she was eating beets and stuff like that. We have a long life span. Black people have. That's why white people wanted us so bad. Not to make it a race thing, but it's just the facts. And you know, everybody laying out facts, but that's just the facts. We have we have things that we could fight against. We have that protection in our body where we could outlast things if we live right, if we treat our body right. We have to live right because guess what? Statistically, it's shown we don't have a leg to stand on. If we don't invest money on the side, we're done. We're done. If we don't get more Black doctors and nurses to come together to try to get their own facilities to help the Black community, because nobody knows us better than us. So don't sit up there and let a doctor tell you because you overweight this year, you won't be better next year. I know y'all don't heard stories when people tell my baby, the doctors told me my baby wouldn't live a year. My baby 15 years right now. You can't go off for science. You got to go off for what you feel. That's why we got these gut feelings. That's why we're mothers. We nurture our kids, our husbands, ourselves back to life. But we can't do it if we're not strong enough to do it. And that's just what it is. We could sit here and make excuses. We could say, oh, I don't feel like it today. I don't want to get up. I don't want to do this. That's basically you taking your destiny in your own hands. You saying, oh, well, I'm gonna let the white people make a doctor. I'm not gonna say white people. I'm not going to even say doctors because they only doing what they told. Basically, when you're dealing with the low poverty Black minorities. Because I know a lot of doctors are trying to push me out the door, but I'm asking questions, but I'm too inquisitive and too invasive to walk out the door without knowing what I know. You're not going to just shove me to the side and say, all right, I see you in 5 years. Why would you see me in 5 years? I'm so happy that was brought up because it was ironic that I've been calling for 2 years, since my son was born. He's 3, he's about to be 4, for I did my postpartum after him. Then I had another regularly GYN appointment. But then I called the year after that. Oh, you have to wait 5. Why? Because they feel I'm healthy enough, just like they said, to live through them 5 years. Whatever she's doing, let her keep doing it. We ain't got to deal with her because she's not a paycheck. She's not money. We gonna deal with the person who's less and see what we can do with them and just give them that and give them that so they can keep coming back. You got to fight for your own life, honey. I know some doctors don't want to hear that, nurses don't want to, but that's what it is. You got to fight for your own life because they can't take it. Even if you going right now, sick and all that, it's nothing they can do. They send you home. Here's some medication. Take care of that. All right, this going to take care of that. But now I've developed liver and back, all types of things. Now, what I'm going to have to take for that? Oh, you're going to have to take this for that. Oh man, then I'm gonna have to, now I'm getting headaches. Here, take this for that. Next thing you know, you got a pharmacy in your house. Oh, I gotta take this for liver. I gotta take this for a headache. I gotta take this for back pain. I gotta take this because my left foot rolled up last week. I gotta take this because my fingers done stiffen up. Why? Because you didn't take care of yourself and you went in for one problem, but here now you gotta deal with 10. I'm telling you, it's serious. It's that serious. It's that serious. You have to take care of yourself. It's no other way to say it. Get up, go run around. And then some of us got so consumed with driving where they won't even walk across the street. I love to walk. I even have my baby to walk. Everybody tell, where you walking to? I can have a pocket full of money, which half times I do, but I will walk if I have to 96th Street if I want to, and back. I will do that. I have done it plenty of times. I don't walk all the way to the Brooklyn Bridge and back by myself, just to walk, just to think, just to get a clear head, just to see what I can push myself to. Sometimes you got to push yourself to see how far you can go. I ain't saying kill yourself, but I'm saying push yourself to the point where you can say, I can do this. I could do this. If I walked 145th today, tomorrow I could walk 125th Street. If I walked 125th Street on Monday, Tuesday, I might walk to 110th Street. Before you know it, you walking every day. Now you drawing out things. You getting your freedom on. You getting the air. You getting the vitamin D you supposed to get. You know, you talking. You happy now. You feeling good, because that's what health does to you. It'll put you in a mind frame where you feel like, I feel good. I feel good. And I don't mind eating a bowl of spinach. And I don't mind drinking a health shake. And I don't mind walking and stuff, because I feel good. You know, instead of staying home saying, I'm so depressed, I can't walk, I can't wait to get this surgery, I can't wait to be cut, the next month you cut again. Then they find something else wrong with you. Why? Because you became an open experience for them. Oh, well, she let me cut it this time. I know if something wrong, knowing that it's going to a chance that they may have to cut you again. Though doctors do give you a chance. Listen, your health getting this way. You're getting a little obesity. Obesity don't mean you have to be drinking. If you're over your size limit, you're on the borderline of obesity. Why wait to cross the line? Get your doctor to check. I know it's easier said as done, because it really is. Once you put it in your mental, you done. You off to the races. And I always tell everybody, give yourself 21 days to clean yourself up out. The reason why I say 21 days, because after 21 days, it become a habit, repetitive. You do it over and over and it become easier. The first day, of course, it's going to be hard. Everything is hard. Getting over a relationship is hard. Getting over a friendship is hard after the first week, the second week. But after a while, what you do? You forget and you lose, you go on, and it become a routine. You start moving, you just stand the third, and life become easier. Take the extra weight off you, meaning your weight, problems that you don't really need, relationships, friendships, all that is weight. All that put depression on you. All that you know what comes to depression? Eating. Once you start eating, you're going to start sitting there and your weight start settling. Then you become used to it. Fuck it, I only gained 5 pounds. Then next thing you know, I only gained 10, 15. Then you're calling up somebody. Girl, I want to lose my stomach. What about the thighs and your arms and your health and stuff like that? It's not all about losing your stomach. It's losing weights, getting it into your mental, letting everybody know I'm here and I'm not going anywhere no time soon. And despite what a doctor told me, despite what the odds was against me, you have to fight for your life with anything. You become, and I think the best thing, like I said, is to get into your mental, make a chart. Because like I said, when you see things verbal every day, you attend, instead of you sitting up there saying, I gotta do this, boom, here you go. Something else come along. You get on the phone. You don't bit past it. The time don't went by. You said, forget, I'll do it tomorrow. Tomorrow go to next week. Next week go to next month. Next month go to next year. Next day, you know, you sitting up in the hospital like, why do my mother don't have it? My father don't have it. Now you got the chances on passing this on to your child. You have to take initiative and be accountable for the things you put in your body daily. You're going to relapse sometimes, and it's okay. Because sometimes you miss that taste. You want that, you just want a taste. So you may go to the store and say, damn, and feel guilty. Don't feel guilty. You want that taste and you just want that taste. And 9 times out of 10, think about it. You can sit there and say, I want to go to the store. I want to get some fish. I want to get this. You get home, you don't want none of that. You take a piece of it, you don't even eat all of it. It's just like a bad relationship. Once again, you want to go back to see if you still You know, if you still, if you really completely out of it. So you don't feel guilty. Don't say, don't deprive yourself. Basically, don't deprive yourself. If you started dieting and you may slip and say, damn, I want a piece of fried chicken today, I guarantee you after that 21 days or even that first week, you are going to take a piece of that chicken and put it down because you just want that taste because you miss it. It's something that you miss, something that you used to. So that's what it is. You're not going to do that if you're not taking vegetables and stuff, because that ain't nothing you miss. You like, I ain't never eat string beans or stuff like. I got grown people in their 50s and say, I never ate broccoli, spinach, kale. I can't believe it. Brussels sprout, like never tasted these things in their life. Not saying that it's impossible and things, but I just can't believe it. Even if things I don't like to eat, I still will taste it to eat, especially if it's healthy. It's like, how you don't eat broccoli, carrots and stuff that helps you with your eyesight, everything. It's been since we've been kids. That was the main thing people tell you: eat spinach. They even told us your gross thing like Popeye. You eat spinach. You sitting up there looking at your muscles waiting for it to grow. But that was the way they fooled you into eating spinach. They tell you eat carrots. It's good for your eyesight and stuff like that. You sitting up there, you don't want to go blind, so you eat the carrots. You know, you do things. Parents used to be, clever with it. Though it do help, you're not going to see like the bionic man. You're not going to have muscles like Popeye, but it will help you in a sense. But we don't do them things with our kids. Our kids will say, I want crab legs. You go get the crab legs instead of saying, no, let me go sneak and go get, okay, I'm going to get a crab leg, but let me sneak and make him a crab leg with kale in it. Let me bake it and see if he liked it. You don't have to deprive him of the things, but you can sneak things in where he don't notice. Cauliflower is a good thing. You can make macaroni. You get things and stuff like that. You gotta you gotta set an example for your kids, because they have to be an example for their kids. And kids develop things just like we do. So you have to be careful on what you put in your your mouth. My son never ate beef nor pork. He's 4, never. That's because me and his father don't eat it. Why would we eat it? Why would I feed it to him? He loved McDonald's. He probably down for a burger, but he'll never know. He will never know. He don't eat junk. People don't, why you gonna give your son junk and stuff like that? Why you don't give him potato chips? Why you don't give him candy? And with the blessings, he don't even eat it. Thank God. He drinks water. Because those are the things that I was doing while I was pregnant. I made sure I try to maintain the diet. With things I didn't do, which caused me to go into early, I dealt with a lot of relationship issues through my pregnancy. So that right there was a blow to me. And because I was going through something as far as losing my son, it put me in a depression, in a closed state where I didn't want to do nothing no more. And I almost lost myself. But I started walking while I was pregnant, went back to dieting, and the things that I was going through didn't even bother me no more. I separated myself. When we had the baby, I was still a little weak, but I knew not to go back where I was going to, which was my comfort zone. Eating, going back to a depression, because I felt like if I eat, I don't exercise, I'm gonna go into this depression. I'm always feeling some type of way because I just lost my son. I had another baby. I'm in my 40s. I can't produce milk. I want to produce milk. I'm going through things. My son's father driving me crazy, but I still had enough fight in me to say, get up and fight. Get up and walk. Get up and do what you got to do. Don't you fall in this depression. I felt it. I'm like, maybe I got postpartum. I went to my doctor. I told them, they ask you things on the questionnaire to see if you have it. Do you want to kill somebody? Do you feel like killing somebody? Do you feel like killing yourself? Things under the nature. I had to really think to myself and say, I feel like I'm already dead right now, because I felt like I was in a box. I'm like, I got to get out this box. And spiritually, with yoga and going back to what I knew, I got out of it by myself. I really was in a fight. I was in a fight, but I said, you know what? I'm not going to let this define me. I'm not going to let this take this away from me. I knew how to fight back, and how I had, because everybody has to find a way to get out of they comfort zone, their depression, they box. And I knew dieting, exercising was my comfort zone, made me happy, made me feel like, okay, you could do this. You're going to live for your son. You're gonna eat right. You're gonna do what you know to feel good again. And those are the things that make you feel good. I guarantee you, if you feel in some type of way and you get up and start walking and moving around and making your body cells get up and dance and move, you're gonna feel good. This is why they tell you, listen to music, dance like nobody's watching you. And those are the things I honestly was doing. I had to talk to myself in the mirror. Get up, do what you gotta do. Yeah, I swear on everything I love, if it wasn't for, and I'm gonna say this again, if it wasn't for me going back to working out, getting back into myself, dieting, eating, and giving myself to God, who knows what I would be in right now? Because there's a lot of, I know for a fact, and I hear it all the time. I get texts, I get inboxes. I don't know how you do it. I don't know how you do it. And personally to myself, I say to myself, I don't know how I do it, but I do it. And that's good for me. I can't tell people how to diet. I can't tell people how to get their health in place. I can't tell, and I won't sit up here and tell you, you do this. But what I'm suggesting is that you do it. You find a plan for yourself. You find a comfortable zone. I don't care if you're in the corner by yourself and you want to lift your leg up and put a leg on your arm, stretch your bones, stretch your mind, stretch everything you could. Weight is definitely a factor of depression. Weight is a factor of health diseases. Weight can definitely put a lot on you. In order for you to keep that weight, and I'm talking about life, period. I'm not even talking about what you intake. I'm talking intake meaning everything, what you intake in your body, everything, the negativity, the food intake, the abuse, all that weighs on you. You have to protect your temple by any means necessary. Sometimes we put on more than we should. I know I do. My sister tell me all the time. She called me ants in the pants. Slow down. Don't do this. Don't do that. But it's just like I can't stop. I'm like a machine now because I felt like my back was against the ropes and I had to fight. And I don't want to get in that motion again. So it felt like I had to fight for my life. Okay, so basically I'm gonna bring it in. I will be doing yoga in the morning. If anybody wants to join in, I have no problem. I can give you the Zoom information if that's what you want. And once again, I want to thank everybody for coming out to listening to everybody. Tomorrow we will have another session. I hope everybody can join. And have a blessed day, and everybody stay safe. I love you, sisters. Y'all are very beautiful. Keep up the good work, and let's put this fight to bed.
Okay. All right. So thank you. So if you have any questions now, I'm going to open up the chat for questions. And I know that there's some comments in there, so I'm going to read some of the comments that are already in there as you were talking. Let's see. I'm gonna go back far back as I can. Let's see here. All right.
Okay, Tonia.
Okay. All right. So the agreement about yoga. Yes, I do yoga at night, and it helps me so much with mood, joint aches, overall health, and sleep. A lot of what you're saying, most of the women have agreed. Mental health is also a challenge in the community. We need to eat a healthier diet and practice mindfulness.
Can I say one more thing about the yoga at night? When you do yoga or even exercise at night, try to do it at least a half an hour or 25 minutes before you go to sleep. Because with that being said, is because if you exercise before you go to bed, your body, you know how it tense up and lock on you, it will lock up on you as well.
Okay. Please invest in a air fryer. So the benefits of an air fryer, if you could speak on the benefits of purchasing an air fryer, those that are able to do so.
The benefit of an air fryer, it will reduce grease, which it cause which you can have high blood pressure, hypertension, develop fatty cells, fat period, because I would just say reduce the grease level. I don't care what it is, olive oil, cooking oil, corn oil, try to reduce that in so many ways. And with an air fryer, you can, because you get the same type of, you would get the same results, if not the same, close to the results you would get frying your food.
Okay. The next one, the statement was advocate for yourself. Yes, as we were talking about all today throughout all of the presenters about advocating for yourself. Plant-based diet. What are the benefits of a plant-based diet?
The plant-based diet basically help you with your skin, once again, your memory, your eyesight, your hair, because once again, we use things with a lot of grease and oil, and it clogs up our pores and everything, and we can't release those things if we're not drinking water, which I meant to bring up. We need to drink enough water. I cannot emphasize that enough. Please, the benefit of drinking water is amazing. It helps you with your skin and everything. Please drink water as much as possible. I know some people don't like it. I would suggest, within myself, I like to drink before I go to bed and when I wake up, some warm water with aloe in it.
Okay. And then you have a few ladies that are asking for your Zoom link for the yoga. And then also I have another participant who agreed that right before you go to bed, there are specific yoga moves I do in the evening, which she does. I do a bedtime routine after 30 minutes to an hour before I go to bed. So it is agreed that yoga is like a healthy step to use. Using aloe drops is also a suggestion in your water. Again, to get yourself to drink water. Okay, what do you think about, and this is a question for me, what do you think about using, in the water, most people would like to flavor their water. Other than using aloe drops, most people may use those drops that they have at the stores. What do you think about those?
I wouldn't suggest, to me, I think water is the best. I wouldn't add anything, because anything with a color mostly has some type of dye in it. I wouldn't suggest none of that. I would suggest just plain water. Some apple juice here and there, cranberry juice, definitely. A little prune juice to move your bowels. I don't know how good everybody move their bowels, but that is very important as well.
Can I add something? I'm
Sure.
sorry, ladies. This is Ashley, the nurse. As much as you can. So going back to your question, April, a very good way to flavor your water is to put fruits in it.
Yes.
Right.
But you cannot use processed, sugary things to flavor your water. So natural fruits, I mean, you get them, you slice them, and you leave them in the water. Don't put those artificial dyes and drops. Those things are cancerous.
Yes.
Right? Remember, I talked to you guys about all of us having cancer cells in our body. It's just a matter of how those cancer cells, what we put into it, and the environment in which we live in, that cause those cancer cells to react. So you have to be mindful about processed things. You have to try to get everything to the most natural capacity as possible without processing it.
I totally agree. I totally agree.
I see suggestions from our presenter for tomorrow. She said lemon slices, lime or cucumber slices. And I do that. I do the lemon so I can have some taste in my water, because I honestly, Water, I'll drink it because I don't have a problem drinking it, but I would love
Yeah.
something to so it's not stale. So what happens to me is that it becomes boring. So for me, I have to make it unboring for me to continue to drink it. Because of course I know water is good for beneficial for your body. But I think, you know, if anyone else may be struggling with the same thing, is to also try to figure out what is more appealing so you
Yes.
can drink water. Okay, I also see ask again about the yoga link, sea
I'm
salt,
sending it
lime,
now.
sea salt, lime, and lemon, and what helps in the water. Okay, all right, and I did get a thank you for the summit. So, is there anything else, Tamika, that you have to say? Because I'm going to open up for more questions. Are there any other things you have to say before we move on to opening questions and before we conclude
Yeah.
for the
Yes, I do. There's a lot of these quick diet things. Please stay away from them. The juicing and all them, I would suggest stay away from them. That's just my opinion with that, because it takes a lot out your body. And not only that, your chances of gaining your weight back faster and more is very high. I stick with do it the natural way. You don't want to be a model. You're not going for that. You don't want to be a sports illustrator model, but you want to be healthy and fit. So try to stay on a regimen and make you do your little schedule and try to stick with it.
Okay. All right. So to the presenters that are still on and to our participants that are here or those that are attending, are there any more questions? This is the time now where you can ask more questions. If you have a comment, do you need clarity on information that was presented to you today before we move towards closing for the day? I'm going to open the chat up now so I can see. Okay. Can you tell me where the yoga link is posted? Okay. Did you post
I'm
the
going to
link?
post it. I'm going to post it right
Okay.
now.
She's going to post it right now, Doc. Okay, so since there are not any other comments or questions, so one thing I would like to do before we close out for today, a couple of things. First thing is I want to thank all the presenters today. We had Dr. Jennifer Wells, who talked about women's heart health. We had Shelly Blake, our pharmacist, who talked about what's in your medicine cabinet. Serena Wills talked about GYN and ovarian cancer awareness. Then we also had Ashley Smith, our RN, who talked about my underlying medical issues, the fight against COVID-19. Tonia Lennon, okay, she spoke about where it starts with the beginning of mom and baby. And of course, our last presenter, Tamika Holman, who she talked about healthier me, what's good to eat. Let's get up and move. I want to thank all of my presenters for their awesome information that was provided to us today. At times, we don't have the connection that we're offering today. You know, when we want to talk to a professional about or healthcare professionals, sometimes we don't know what to ask. But I did, or brought this forum together, this summit together for women, because we do need to take care of ourselves, because we usually put ourselves on the back burner. And we forget that we should be number one. So if we can't take care of ourselves, we sure enough can't take care of no one else. And I believe that every presenter today here has that same consensus of why we need to take care of ourselves. So we do have our part 2 tomorrow, and it starts at 11 a.m. So what I would like to do is provide to you the topics that we will be addressing tomorrow, and then we will be concluding for the day. If you have any questions, and some of the presenters are on, I will make you aware if they show up tomorrow. And if you come across a question, please feel free to put it in the chat. And not only that, I can get the questions to them if they are not there. So for tomorrow, our presentation will begin at 11 a.m. We're going to have taking care of me with no excuses. We also have living in the skin you're in. The next topic after that is magic hands, about massage therapy. And then maintaining mental health by seeking therapy. And the last presenter will be talking about coping with trauma and when to seek therapy. What I highly suggest that those of you that got something out of today, please encourage those to participate tomorrow. Because again, these things are offered to us, but yet we don't want to utilize it. I think at times we focus on, some of us focus on the negative things out there instead of focus on things like our health, how to take care of ourselves, what to do when we need to talk to professionals. So I highly encourage that you please speak with anyone that you know that can benefit from tomorrow, because a lot of it that we're engaging towards is moving towards mind, body, and soul. Today was definitely about internal, how to take care of yourself inside, but now we're going to touch on the mind, body, and soul tomorrow. Okay. And before we go, I think that will be it, right? So we're done for the day. And if you have any questions, please feel free to put it in the chat tomorrow if you like. And I, again, will get it to those presenters that presented today. Did you have something else to say, Tamika?
I was just I sent you the link.
Oh, no.
So if you could put
Okay.
it in for me, because it was on my phone and I put
Okay.
it, you know. So that would be, the link is going in there. It's going to be
sent the link? Okay.
Monday, Wednesday, Friday, and Saturday mornings, 6:30 a.m. And then I'm going to do another one at night at 6 p.m., which is not going to be Zumba. It's going to be more like an exercise, but more in the slow pace where we can get a regimen going on and a routine. So I hope to see everybody there. I hope whoever can make it. But anytime y'all feel free, y'all can come on in.
Okay. All right. I'm going to put this in the chat for you all. Give me 1 second here. Oh, okay. This is the link right here. Oh, I see it. 3. Okay. Give me 1 second, ladies, and I'm going to put this in for you all.
Ooh.
Nope, too many sixes. 6660. Okay. And then, okay, I see the meeting code. The meeting code is B31AGA. Is that right?
I say yes.
Hold on, JoJo. Okay. That was AG. Okay, so the meeting code is actually in the chat, and if you need it, and if you do want to reach out to me, I'm also going to put my email address in here as well. And if you are looking for any other presentations that you would like to see in the future, please let me know. So then I can start working on the next summit, because I'm looking forward to doing that next for us. So any suggestions at all would be great. You can go.